Good morning, everyone. We are now opening and commencing our meeting. This meeting has been called to order at 9 a.m. I'd like to ask everybody to have a moment of silence, silent reflection, or silent prayer. I'd like to ask Fire Chief Dennis Bitters to come down and please lead us in the Pledge of Allegiance. Good morning, sir. Thank you, sir. For the record, this is the board meeting of February 23rd, 2021. Madam Clerk, roll call, please.
Thank you, Chairman. Supervisor Miller?
Here.
Supervisor Nguyen?
Here.
Supervisor Villapudua?
Here.
Supervisor Rickman?
Here.
And Chairman Patty?
Present, thank you. At this moment, County Council, do you have something for us?
Yes, thank you, Chair Patty. We are requesting that the board at this time recess to closed session to provide staff direction on closed session item number 1. I don't think that it will take too long and we should return shortly.
All right, well then at this moment we will recess and we will be back quite shortly. Thank you. right, thank you, everybody, for being patient. We are now back in session. County Council, do you have an announcement for us?
Thank you, Chair Patty. Closed session item number 1, let me turn to that page. Public employment for the county administrator is going to be continued until March 3rd, 2021, and a separate agenda will be posted for that.
Thank you. Moving on to recognitions and presentations. Today we had scheduled the 2021 State of the County presentation. This item has been postponed till March 9th of this next month. The Board of Supervisors has a recognition of retiring San Joaquin County Employment and Economic Development Department, the Executive Director, John Solis. I'd like to read a notation and a summary of this exemplary employee here in San Joaquin County and all of the fantastic things he has done. This is a snapshot. With over 40 years of workforce and economic development experience, Mr. John Solis is retiring as the Executive Director of San Joaquin County's Employment and Economic Development Department. Mr. Solis has been an involved and engaged member of several county chambers of commerce supporting business development. He's a standing member and past chair of IHUB, San Joaquin County, representing the county's Economic Development Association, and a long-standing chair of the Hire Me First internship program, serving high school students in the Tracy community for the past 10 years. John has a passion for service, but one of his greatest passions has been working with youth. He strongly believes that it's much more cost-effective and rewarding to work with them in preparation to take their places as leaders and future workforce. In 2018, Mr. Solis and the Workforce Development Board, in partnership with the Board of Supervisors, launched 2 programs and became the first county government in the nation to establish an apprentice program with a focus on incumbent workers in civil service system with both state and national certification. The San Joaquin County High School Apprentice Program became the first official high school apprentice program that also included public agencies acting as employers in a civil service system. 6 apprentices were onboarded in a virtual signing ceremony celebrating their first high school apprentices in the state of California. Under his leadership, the Employment and Economic Development Department was the 2019 recipient of the San Joaquin County's Equal Employment Opportunity and Diversity Award. Mr. Solis's agency has received 10 national awards for exemplary program development, including the Presidential Award, which he accepted in Washington, D.C. in 1993. His department is the recipient of the National Alliance of Business Distinguished Service Award for combining workforce development and economic development under one roof. We here in San Joaquin County are grateful for the dedication and positive impact that you, Mr. John Solis, have had in our workforce development. Your efforts have influenced future generations. And we thank you, sir. Would you like to share a few words with the board?
You hear me? Okay. Chair Patty, members of the board, thank you for these kind words. My career in workforce development started in February 1st, 2080, when I started working as a contracts analyst under the Comprehensive Employment and Training Act. It just seems like yesterday when the San Joaquin County Board of Supervisors now established what is now the Employment and Economic Development Department in 1983, and I came on board as part of the development team. And now, 37 years later, I am the last man standing, the only one from that group that still remains in the department. I want to thank the San Joaquin County Board of Supervisors for the honor and the privilege of serving you and my community. It has been an honor and a pleasure. They say that a dream job is one that you would do for free and get paid for it. Well, that's what I have had, and for that I am truly grateful. Much has been accomplished that we could be proud of. First and foremost, the performance standards. We are a performance-driven system, and we have exceeded performance objectives established by the U.S. Department of Labor, the State of California, and the San Joaquin County Board of Supervisors, and we have exceeded these performance objectives each and every year since inception. As you mentioned, that we did receive the Presidential Award in Washington, D.C. in 1983, and we were the National Alliance of Businesses' #1 service delivery area in the nation. We got the Distinguished Service Award for combining workforce development and economic development under one roof. Since then, numerous workforce development areas are braiding economic development and workforce development, because now it's recognized that workforce development is economic development. What was now once unallowable cost, economic development activities are now mandated services under the workforce service delivery system. Economic development organizations are now mandated partners and are required members of the Workforce Development Board. You mentioned the apprenticeship program. San Joaquin County government became the first civil service system for incumbent workers, an apprenticeship program that has national and state certification, and that was established in 2019. You mentioned the high school apprenticeship program, and it has California certification from the Division of Apprenticeship Standards. Those two programs have put San Joaquin County on the map, and we should be proud because they're the first. I leave you with a comprehensive one-stop center with the highest score and certification, a hallmark of excellence certification for the Lincoln One-Stop Center in downtown Stockton, and we will work towards certifying the new center once we move in. As you know, we were the administrative entity for the California Enterprise Zones designation in San Joaquin County. E2D2 and the ADA issued $3.1 billion in hiring tax credits, which continue to support small business development even now. Everything that we have accomplished comes as a result of team effort, an outstanding team of dedicated, passionate, and public servants. And I have an outstanding team of workforce and economic development professionals with strong leadership. I credit our team at San Joaquin County WorkNet who worked with me, and I would be remiss if I did not recognize my appreciation for everything they have done for the Employment and Economic Development Department, San Joaquin County, and the Board of Supervisors, for their support, for their loyalty, and their hard work and dedication. I greatly appreciate that. So it is with a heavy heart that I step down and pass the torch to my staff. They are a team of highly qualified and talented individuals that will take the department into new heights. To my bosses on the San Joaquin County Board of Supervisors, I appreciate your leadership and your continuing support. It has been an honor and a pleasure serving you and my community. Thank you very much.
Thank you, Mr. Solis. I'm going to meet you down front here. We have a plaque to give you, and I'm going to ask our Public Works Director, Mr. Balaji, if he'll be so kind to take a picture for us to commemorate and share. Thank you. I'd also like to ask at this time, Supervisor Villapudua, would you like to say a few words?
Yeah, Mr. Solis, hey, I've worked here for 4 years, and I can see the quality of work you did for this county. I know you helped a lot of people troubling times. I just can tell you, I hope you enjoy your retirement and how much we appreciate everything you did for this county. And I'm sure all your staff and employees and everybody who came into contact with you, you'll be missed. So congratulations on your retirement.
I'd also like to ask, as we're all masked, it's kind of muffled, so make sure you bring in that microphone close to you when you speak so that we can hear clearly, and Mr. Solis appreciates these words. Supervisor Miller.
Thank you. Mr. Solis, it's been a pleasure working with you the last 6 years. You have done amazing things here for San Joaquin County and for the residents. And our small businesses. I worked with you even when I was at the city on the enterprise zones. You really led the way on a lot of important issues, and we're grateful for your many years of service, but we wish you all the best in your retirement. It is much deserved, and I know your family will be very pleased to have more time with you, and we hope you enjoy it. Thank you.
Supervisor Rickman, I know as representing Tracy, you might have a few words.
Yes, thank you, Chair, and thank you very much. I'm only been on this board here a little over about 2 months or so, but I have worked with you when I was the mayor of the city of Tracy. So I want to thank you on behalf of, of course, the city and of the county. But one thing I want to mention is, our interaction with you. When I was mayor at the Hire Me First internship program, which I loved, which is a great program. And if people aren't familiar with it, it's a Hire Me First program. It helps our business advertise those career and employment opportunities that are available in our community, which helps our youth get into internship. But I just want to give these stats, and I think they're very, very impressive. And, you were instrumental in this program working. The Hire Me First internship program had a total of 144 participating businesses with internship positions for approximately 476 participating high school students, 328 internships per semester. Over the past 11 years, well over 208 employers and businesses have participated in and supported the Hire Me First internship program. Over the past year, 1,129 students have participated in at least one activity offered by the program. So thank you for not just what you've done for the county, but for our youth in the 5th district and throughout the entire county. You will be missed, and enjoy your retirement. Go do some fishing. If you do, give me a call.
And Supervisor Wynn.
Thank you, Mr. Chair. John, it's been a real pleasure. I will miss your illumination on a variety of subjects. But recently, especially with the apprenticeship programs, both high school and incumbent, you did an outstanding job. And one of the things that I appreciated most was your tenacity in bringing all these groups together with one common goal was astounding. And so I think that, among all these other things that have been mentioned, will be part of the legacy that we will all remember as you go into retirement and hopefully enjoy the next chapter. So thank you for all you've done. Appreciate working with you and look forward to talking with you and gaining your insights in the future. Thank you.
Well, as you see, we all have a lot of gratitude, and we represent many boards you've worked on behalf and the entire county that you've served for these many years. But I'm sure you're looking forward to relaxing a little bit, enjoying some time with family and perhaps some travel, and we are truly grateful. I do have an award for you, a plaque to hand you.
Chairman Patty, if I may. Chairman Patty, I do have a comment from Lori Cruz. She would like to thank John for his service to the county. That was from Director Lori Cruz of Department of Child Support Services.
So I know that the supervisors, Supervisor Wynn stole everything that I wanted to say about John. It was very fitting. And, much like Supervisor Wynn, John, you inspire me by your vision. These people, don't come to this place as work, actually. I mean, you know, you do it with the heart, actually. And that makes me look forward to come to working amongst people like you. So, and I tell you though, among everything else that you folks said, I'm going to miss John on one most important thing. You know, you made me look good all the time because you competed with me every budget hearing by taking the longest time. Usually it'll be me, right? Usually it'll be me, but John will go over my time, making me look good. Thank you, John. Appreciate that thing. Godspeed to you. Best of luck.
Mr. Chairman, thank you for the opportunity to say something on a more personal note. I do recognize that John Solis has brought in a lot of innovative solutions to the problems the county faces, and I know the county appreciates that. I know John is one of the hardest workers. I would call him sometimes as early as 7 o'clock in the morning, and he's there. Then I call him at 7 o'clock in the evening, and he's there. So I really appreciate his really hard work. But honestly, the thing that I appreciate about John the most is his ability to cook crab. John was part of a group that had a crab feed every January. Unfortunately, this last year we weren't able to have it, but it's the best crab ever. And I know Rosa, his beautiful wife, is going to probably be a little sad to have him around the house as much as he's going to be now. But thank you, John, for the opportunity to be friends with you for these many years. And good luck to you, and God bless you in your retirement.
And John, as you remain involved in the county and still doing fundraisers and benefits, make sure that you are invited, because we do like going to crab feeds and supporting our community. So thank you, sir. Now is the time for public comments on matters within the jurisdiction of the Board of Supervisors that are not listed on the agenda, and any matters listed on the minutes, appointments, or consent agenda. Public comments limited to 250 words or less may be submitted by sending an email to San Joaquin County SJC public comments at sjgov.org. With regard to the public comment, the law strictly limits the ability of board members to discuss matters not on the agenda. So this is not an appropriate time to discuss with the board regarding your comments. We ask that you refrain from personal attacks during your comments and that you address all comments to the Board of Supervisors. Comments from the public may not reflect the point of view from the Board of Supervisors. Madam Clerk, have we any public comments for today?
Thank you, Chairman Patty. Yes, we do have a few public comments today. The first is submitted by Dominic Gooley regarding consent calendar item number 1. Approval of the rejection of bids for the airport cargo ramp expansion project. Mr. Gooley writes, it's reassuring to hear that the airport cargo apron constructed in 2002 is fully saturated with aircraft, ground handling, and cargo loading equipment. Sounds like jobs, jobs, jobs. Unfortunately, it appears there is not adequate funding available at this time to fund the upgrade to create more jobs. Thank you, supervisors, for being fiscally prudent and rejecting the bids until the funding is in place. It is comforting to see that the board is considering taking Mr. Russell Stark's advice to wait until adequate funding becomes available in 2022. It is excellent practice to only commit funds to that which there are funds available, and I trust that is the preferred practice of our Board of Supervisors on all expenditures. Second, Mr. Gooley submitted a general public comment regarding FEMA flood elevation certificates, and he writes, as a licensed land surveyor is a qualified professional to prepare FEMA flood elevation certificates. For the Country Club and Mont Diablo are of the county, the San Joaquin County Public Works Department requires surveyors use a special flood hazard area, AE zone, with a base flood elevation of 9.4. This results in depths of flooding of 4 to 12 feet and very expensive flood insurance. This was based on a 2012 letter from a FEMA employee for a proposed floodplain used to establish an assessment district. The proposed floodplain was put on hold in 2012 and is moot. The DWR levee evaluation report for the Smith Canal levees indicate that for the most part, levees exceed the engineering requirements of the urban levee design criteria. 200 year. If the county were to revert to the FEMA flood map of SFHA of A with no base flood elevation determined, as shown on the FEMA flood insurance rate map, the finished floor is required to only be above the highest adjacent grade. Flood insurance rates for the disadvantaged community could be reduced by a factor of at least 20, and homes in the county would have no building restrictions. The next comment is submitted by DeAndre Davey of Central Valley Realtist Board. And he writes, the Central Valley Realtist Board, a local chapter of the National Association of Real Estate Brokers, funded in 1947, making it the oldest black real estate trade association in America. The organization was formed out of a need to secure the right to equal housing opportunities. Since its inception, NAREB has participated in various meaningful challenges and legislative improvements to establish fair housing for all. CVRB writes this letter in concern for San Joaquin County's response to the pandemic housing crisis. Congress allocated funds for a statewide program, Eviction Protection and Debt Relief, SB 91, that authorizes eligible local jurisdictions the option of creating their own program to assist families' housing needs. Under SB 91, $2.6 billion in federal relief funds will be distributed to landlords who have lost rental income during the COVID-19 pandemic. By not applying for these funds, San Joaquin County would have left money on the table to assist and alleviate stress from the county's most vulnerable residents and small landlords. San Joaquin County received a response of over 3,000 applications from the Family COVID Assistance Grant, which illustrates the residents' needs. It is important for residents to know that SB 91 also extends residential eviction protections through June 30th, 2021. It is imperative for the county to remain proactive in addressing the growing effects of the pandemic, as unstable housing leads to homelessness. Please provide an update on how the supervisors are addressing the pandemic housing crisis in San Joaquin County. The next comment is by Marian Lindo, who writes, good morning. I would like to ask the BOS why you have not set up a place and time to have your county employees who are in the 1B category vaccinated. I see other groups in our community getting vaccinated, some who have not been working before us who have been on the front lines as essential workers. I do not want to travel to Oakland to get vaccinated, and I am so tired of looking at pharmacy sites to try and sign up with no availability. I want the county to send word to our department chairs to send employees to the county hospital or public health department to get our first doses. Please make this your priority, as we have made our jobs a priority for the community in which we serve. The next comment is submitted in partnership with the Community Foundation of San Joaquin A+, and the Business Council of San Joaquin. And they write, we applaud the Children and Youth Task Forces and the board's forward thinking on developing a short and long-term strategy for our community to emerge safely from the pandemic. The societal and economic aftermath left in the pandemic's wake will require all sectors of the community to work together in partnership with local, state, and federal government to rebuild our county. To that end, our three organizations, the Community Foundation of San Joaquin A+, and the Business Council of San Joaquin, pledge to assist policymakers in whatever way we can to rebuild our community. Our three organizations are in the process of assisting the state of our respective sectors and obtaining data to help inform policymakers' decisions. Our organizations serve the K-12 education, business, and nonprofit sectors of the county. Our organizations appreciate the board's willingness to learn more about the immediate and long-term needs of children and youth and the community as a whole, as it seeks to develop a plan for our county to emerge and rebuild post-COVID-19, and thus we welcome the opportunity to share the perspectives and needs of our respective sectors. The next comment is submitted by E. Clark, who writes, I am writing this as a community member, Stockton resident, and social worker with San Joaquin County. I am asking for your assistance in prioritizing access to receive the COVID-19 vaccination. To my knowledge, myself and many other fellow employees who would like to receive the vaccination qualify for Phase 1B Tier 1 access, yet it is taking a while for this county to roll out vaccines for non-healthcare emergency service workers. Throughout this pandemic, we have continued to work. Our offices were never closed to the public, and as a social worker, I've continued to go into homes and crowded courtrooms. We continue to put our health and our families' well-being in jeopardy and deserve to receive more urgency in making the vaccination available to us. Other counties are already vaccinating their Phase 1B Tier 1 individuals. I know our county could prioritize vaccinating educators for the sake of getting our kids back in school, but please don't forget or delay assisting us frontline workers who have remained providing services to our community. As a social worker, it's not uncommon for me to have to hold a small child and transport them from a home, daycare, etc. for various reasons or services. You see the need to protect educators and healthcare workers. Please also see the need to protect us social workers who work tirelessly to protect children in our county. The next comment is from a longtime San Joaquin County nurse who writes, when nurses organized to speak out at the last County Board of Supervisors meeting, we were feeling dejected and demoralized at the prospect of the county spending additional money on replacement nurses. Since then, the county, under Board Chair Tom Patty's leadership, has proactively been working with us to avoid this situation. Us nurses really took to heart that the County Board of Supervisors, in stepping up in their leadership to address the concerns we laid out in the last BOS meeting. Nurses and community members alike asked for the BOS to do the right thing and avoid spending money on replacement nurses when they could be dedicating that money towards a fair contract. While our contract is still open and not resolved, we see the decision from county to not spend $4.3 million on replacement nurses as a gesture extended in good faith so that we can continue building on all the progress we've made in bargaining. This proposal indicates that there is a trust that both the county and nurses will come to the table within the 45-day time period and work diligently toward a solution that gives nurses the fair contract they deserve. The next comment is from a hopeful nurse who writes, as a nurse who has worked tirelessly without a contract for over the last 2 years, it has been a while since I've seen the light at the end of the tunnel. At last week's Board of Supervisors meeting, we heard strong statements from Board Chair Tom Patty and Board Member Miguel Villapudois on the importance of the county stepping up in their leadership to do the right by nurses and pay us fairly. We were heartened to see that there is a consensus among the majority of the board that one of the most alarming issues San Joaquin General Hospital faces is in the inordinately high turnover of nurses as they leave for other hospitals in the region. We know we have allowed 45 days for the conversation between us and the county to continue taking place, but expediency and urgency is key. We have been and will continue hemorrhaging nurses in that period of time. In the last 2 weeks alone, we have lost 15 nurses within 5 units of the hospital. The sooner we can get a fair contract, the more likely it is that the nurses who have worked in our communities day in, day out, over decades will have a reason to stay. The next comment is anonymous and writes, as nurses, it is never an easy decision for us to call for a strike. We work day and night to care for our patients, and the last thing we want to do is not be at our patient's side. But when a hospital or employer devalues its nurses so much and puts the bottom line before safe patient care, it is incumbent upon nurses to fulfill their oath to fight for our patients. I, for one, am pleased at the steps the county, at the behest of Supervisor Patty and our bargaining team, took to avert the planned strike. It was a very important step and a meaningful path to reaching parity with St. Joe's and finally getting us to the contract we deserve and need. I know that our bargaining team is willing to meet day and night to get the contract we need before 45-day period ends. The next comment is submitted by Matthew Schaefer, labor representative for the California Nurses Association, who writes, I would like to commend the board for their decision last week under Chair Patty's leadership to seek a creative and constructive means to avert the nurses' strike. While there is still significant work to be done to gain parity with surrounding competitors, the county's move was a step in the right direction of respecting and honoring nurses, which has been missing in the previous 2 years of negotiations. We are hopeful that the county's step last week signals a willingness to move toward competitiveness. Remaining competitive and investing in the hospital and nursing retention is not only necessary, but is also the financially responsible thing for San Joaquin County to do. The CNA nurse bargaining team remains committed to the bargaining in good faith, to getting to a fair and equitable agreement with the county, and to do so as soon as possible. Thank you. The next comment is submitted by Christina Gilbert, Director of the San Joaquin Children's Alliance, who writes, Chair Patty and Supervisors, I again thank you for the opportunity to present on behalf of the Children's and Youth Task Force at the last board meeting. We continue to urge the board to allocate funding to stabilize families and expand outcome-driven programming that is desperately needed now to mitigate impacts from the COVID-19 pandemic. There is much we can do now, and your trusted community partners stand ready to collaborate and meet the need. Investing now will help us limit the long-term impacts of increased homelessness, mental health impacts, educational losses, child abuse, and more. There is a tidal wave of need coming, and our school districts cannot be expected to deal with the entirety of the impact to children and youth. Investing some of the $70 million remaining in prevention is imperative and is a fiscally sound decision. Additionally, investing now allows us to send more trusted partners into the community to educate about vaccines, their effectiveness, and safety. Now is the time to act. I asked last week that the board direct staff to work with myself and a small group of leaders to put together proposals for the board to consider. We are still waiting to be contacted. Your leadership is needed to help struggling children and youth in the county today. You have the financial resources and the community partners ready to act. Thank you. The next comment is anonymous and writes, I don't believe that Supervisor Patty's latest embarrassment was based on sexism. Rather, it was just his political pettiness that blew up in his face. In typical Patty fashion, he blames everyone but himself. To then lash out at staff and try and blame them is shameful and disgraceful. We should be embarrassed by his behavior. I know I am as a resident. I am embarrassed to say that he represents the leadership in our county. I wonder how many potentially good CAO candidates didn't even apply because they want nothing to do with him and this board. It is humorous to hear Patty claim his concern was fiscally motivated and then refuse to have a discussion of spending up to $60,000 on a short-term interim CAO was fiscally responsible. Supervisor Patty, no matter how much you may want to be, you are not a dictator, emperor, or king. You are one of 5, and your role as chair is temporary and ceremonial only. You are not more powerful or important than your fellow board members. You owe the staff who have suffered the brunt of your tantrums an apology. Surprise me and do the right thing for once. Apologize to the staff you have mistreated, own your mistakes and poor behavior, and start acting like the leader you were elected to be. I hope the rest of the board would ensure staff are not unfairly targeted in the future. And Chairman Petty, that concludes the public comments that I've received this morning.
Great. We finished with the best for last. I will, at this time, announce that we have 2 scheduled public hearings related to the sale of county surplus real estate that will occur on this at this agenda. We have, and now is the time to open the bidding for the sale of county surplus real estate at 205 West 9th Street in Tracy. I believe we have our General Services Director representing this issue, and please give us a report.
Good morning, Chair, board members, Council, CAO, Marcia Cunningham, Director of General Services. With me today is Assistant Director David Tulliver. David is going to provide a summary of the surplus property that's for sale this morning.
Good morning. And if I may make a brief comment, General Services would like to thank the Chair, the Board of Supervisors, and the Clerk of the Board for moving this item up on the agenda to accommodate some of the bidders, some of them who are present today. And I'll make my comments brief. On January 1st or January 5th, 2021, your board approved a resolution of intent to sell surplus real property located at 205 West 9th Street in Tracy. This location previously housed public health clinical services. You may recall that this property was previously up for sale at the November 17th board meeting last year, but due to COVID restrictions and technical issues, oral bids as required by law could not be submitted and no purchase was consummated. All interested parties from the November 17th have been notified of this meeting and invited to attend in person or by telephone to ensure a fair opportunity to participate in written and/or oral bidding. The January 5th resolution established a minimum bid of $400,000 for an as-is sale with no contingencies, along with other procedural requirements for participation in the bidding process at today's meeting. Notice of the resolution and proposed sale were posted and advertised, and certain public agencies were notified of the county's intent to sell and provided an opportunity to declare an interest to purchase. No responses were received. Your board set February 23rd, 2021 in the chambers of the Board of Supervisors as the time and place for the opening of written bids and the conducting of oral bidding for the proposed sale. This concludes my report.
Ms. Cunningham, do we have anything further, or do I ask, we proceed forward and ask, okay, so I'd like to ask that, Madam Clerk, if we have any written bids have been received at this time for this property?
Thank you, Chairman Patty. Yes, we do, and I'll open those now, and I'll announce the bids.
Thank you.
Okay, Chairman Patty, our first bid is submitted by Anil Wadhwani in the amount of $420,010. A cashier's check of $20,000 has been submitted. Chairman Patty, our second bid was submitted by Gurpreet Diwali in the amount of $410,000, and a cashier's check of $20,000 is included. Chairman Petty, our third bid is submitted by Christina Rodriguez in the amount of $400,000, and a $20,000 cashier check is submitted. And Chairman Petty, our final bid is submitted by Vincent Marchini in the amount of $428,000, and a check for $20,000 deposit is included.
Thank you, Madam Clerk. So at this time, we need our General Services Department, our Bright Director and Assistant, to calculate, I believe we need to calculate the 5% above the highest bid and open up to oral bidding. Is that correct?
Correct.
Okay, so let's proceed with that. I'd also like to announce that interested bidders may be present in the chambers or may phone into the hearings at 209-645-4071. Conference ID number 432-844-595 #. Phones can be muted or unmuted by pressing *6. We need to have minimum bid increments of $10,000, and we would announce announce your phone number as you make your bids if you are bidding telephonically. What would be our opening bid as we have, and do we have people present that are interested in this property? Please raise your hand. Okay. We have, I see 2, 3, and you could bid where you are, I believe would be just fine. And then as we go forward,
Patty,
we'll engage.
I apologize. They will need to come up to the microphone so that we can capture their bids for the record.
Should we go by raising hand and then we know what their bids are as they can announce it, or if we're increasing by 10,000 because we don't have enough microphones for everybody to be at?
They could potentially line up. We do have markers on the floor to come up one by one to make their bid. And if County Council or General Services has any other information on procedurally what they need to do, but they can come up and make their bid at the podium, step away, the next person can make their bid.
And do they have to announce that bid personally, or can I identify where the bid is and we move up? Because this could be cumbersome if we have alternating people going to a microphone. I like it that they're spaced out. We're respecting the protocols of safety. So I think we could announce, County Council.
My concern would be because of wearing the masks, it's sometimes difficult to hear what people are saying. So we want to make sure that we're actually capturing their statements on the record, and that it's not potentially getting misstated by the chair or the clerk.
And a raising of the hand would not suffice.
Well, raising of the hand only identifies that they want to bid, not necessarily what their bid may be.
Okay, and so my question would be then, let's say we've got several raising of hands, then we finally narrow down the person that has the highest bid, that has raised their hand successfully to the highest point, they could come forward and state that amount.
There's not a restriction, although there is a minimum increment, there's not a restriction that prevents them from bidding more than that amount.
Understood.
So I think that my advice would be to let the individuals come forward to the microphone, make their bid. Those who are standing behind them can then determine whether or not they want to bid above that level
Very
or
well.
not.
Let's try that. So we do have a microphone here. We'd like to ask that you space out. We don't want to break the California OSHA laws that are requiring distances between bidders and people indoors. So please come forward if you're going to be interested in this property. We do have a starting bid. Mr. Tolliver, what would be our starting required bid?
I'd like to confirm with the clerk that the highest bid was number 4 at $428,000.
That is correct.
Thank you. 5% of $428,000 is $449,400. That would be the opening bid.
Okay. And Madam Clerk, do we have anybody that's called in to bid on this property?
I believe that everyone is present to participate. I do not see any participants on the Teams meeting that may be interested.
Okay.
But I will ask at this time, in case I've missed anything, if anybody is participating telephonically, to please comment at this time now. You can do so by unmuting your telephone by pressing *6. So please, if you are interested in bidding on the Tracy property, press *6 and announce your presence.
And this is property 205 West 9th Street in the great city of Tracy. All right, so we are going to open then at $449,400 as the minimum opening bid, and we need increments of $10,000 from that point forward.
Correct.
That's correct.
All right, and we also will require, I believe, for the record, a $20,000 deposit for the successful bidder, whomever that may be. Is that correct?
Correct.
Okay, thank you. So if we have an opening bid of $459,400 or greater, please step up to the microphone and place your bid.
I'm sorry, Chairman Patty, the opening bid would be a minimum of $449,400. That's the 5% above the current bid.
That's correct.
And then
Thank you.
minimum increments of 10,000 above that.
Thank you. You are correct. So we are looking for an opening bid of $449,400, and anybody interested would have to go $10,000 above that.
Yes.
Whoever would like to step up to the microphone, go first.
$450,000.
And can I please ask you to identify your name?
Gurpreet Dhaliwal.
Okay, we have $450,000. We would now need a bid for $460,000 or greater.
Martini, 460,000, please.
Okay, Vince Martini, 460, looking for a higher number at 470,000 if somebody's interested.
Gurpreet Dhaliwal, 470,000.
All right, we now have a bid of 470. We'll look for $480,000 for anybody interested or greater.
480.
Identify yourself into the microphone, please. That microphone will adjust down.
480,000.
I did not hear that.
480,000.
Amy Dawson?
480.
$480,000. What is your name, please? Christina. Okay, thank you, Christina. When you come up to that microphone, speak loud and proud. Thank you.
Vince Martini, 490.
Vince Martini, 490. We will be looking for going to $500,000 for this property.
Gurpreet Dhaliwal, 500,000.
Mr. Dhaliwal, $500,000.
Vince Martini at 510.
Vince Martini, 510, looking for 520.
Gurpreet Dhaliwal, 520.
We are now at 520, looking for 530. 530,000 would be the next bid.
Vince Martini at 530.
We are now at 530, looking for 540 if an interested party.
Gurpreet Dhaliwal, 540.
Mr. Dhaliwal, 540, looking for 550. I see 540 going once. And Madam Clerk, do we have anybody, or is there anybody that can identify if you press *6 if you've called in? Do we know if anybody has called in on this property? Hearing no one, seeing no one, we have a high bid so far of $540,000. That is going once. We have 540 going twice. We have 540 sold, sold, sold. Thank you very much. Please come up. And anybody else that has sent in a bid, your money will be returned to you in the coming days. County Council or Madam Clerk, any further announcement on this property before we move on to our second property?
I would just note that, as a reminder, the county property manager will return unsolicited bidders' deposits from the GSD office on or after Thursday, February 25th, 2021.
Excellent. Thank you very much. We are now going to move on to our second property, and this is at 210 North Sacramento Street in the city of Lodi. I'd like to ask that this will be a time for opening bids, and will General Services please give us a staff report?
Thank you, Chair Patty. On October 6, 2020, your board approved a resolution of intent to sell surplus real property located at 210 North Sacramento Street in Lodi, California. This location was formerly used for Agricultural Commissioner's office space. The resolution established a minimum bid of $250,000 for an as-is sale with no contingencies, along with other procedural requirements for participation in the bidding process. Notice of the resolution and proposed sale have been posted and advertised. Certain public agencies were notified of the county's intention to sell the property as surplus. The notice provided these public agencies a 60-day window in which to declare an interest in purchasing the property. The county received one inquiry, which was later withdrawn. Your board set February 23, 2021 in the chambers of the Board of Supervisors as the time and place for the opening of written bids and the conducting of oral bidding for the proposed sale. This concludes my report.
Thank you, sir. And Madam Clerk, do we have any written submissions? And if so, would you please open those up and read them into the record?
Thank you, Chairman Patty. We have not received any written valid bids. Therefore, the minimum oral bid is $250,000.
Okay. And have we anybody that's called in that we know of to bid on this property?
I do not believe that we have any members of the public participating remotely for this property.
Okay, if anybody is by chance, press *6 and join this meeting and let us know that you are present. Do we have people present in the audience? Please identify yourself by raising your hand if you are interested in property located at 210 North Sacramento Street in Lodi. I'm not seeing anybody present in our audience. We have no interested parties. Nobody called in, nobody wrote in. All right, so then what announcement or what would be our next step, stage, or process?
We'll continue to market the property and return to this board with future updates.
Okay, very well. Well, that concludes this session. Thank you.
Chairman Patty, General Services, is there any action that needs to be taken on the first item by the chair, or on this item to provide any direction to the board or to the staff?
Thank you for reminding us of this point of order. We'll have a board order if we don't have a bid offer. So for 210 North Sacramento, we would have a board order, and we will have a resolution if we do have a bid offer. So we will have a resolution for the first item. We will not have two items for each of those items, just only one.
Yeah, and for the record, just as we've concluded this hearing for the first property, 205 West 9th Street in Tracy, we will have all county property manager will return all unsuccessful bidders' deposits, and that will happen on or after Thursday, the 25th of February. And staff will coordinate this purchase and sale documents for execution by the chair. So congratulations, and thank you very much for participating to everybody. Madam Clerk, is that everything?
I just want to confirm with County Council, does the board need to take action to adopt the resolution in the board order?
Yes, the board does.
So the board will need to take action on both item number 1 to adopt the resolution, and on item number 2 to adopt a board order that there are no bids for the second one.
Okay, well then I'm looking for a motion and a second so we can vote on this.
I would move to approve on item number 1, the sale as conducted for $540,000, and authorize the chair to sign the resolution.
Second the motion.
We have a motion and a second. Please vote. Thank you, Supervisor Miller, for summarizing that so efficiently. This has passed 5-0. Thank you very much. We are now moving on to minutes, and there are no minutes for
We need
One more.
one more.
Oh,
I would.
second one? Okay.
I would move that on item number 2, the property at 210 North Sacramento Street, Lodi, that we authorize staff to continue marketing the property.
Second the motion.
Motion and second. Please vote. That has passed 5-0. Can we go forward now? Thank you. All right, we have no minutes for approval on this date. We have Supervisor Wynn. Do we have appointments to the board and commissions?
Thank you. I make the following recommendation in the form of a motion. For council for quality education and care of children, one position, which is discretionary representative position 2504.3, Liz Anderson. Again, I make that in a recommendation in the form of motion. I need a second. Thank you.
Second.
We have a motion and a second. Please vote. That appointment is approved 5-0. Thank you very much. Next, we have our highly anticipated and informative COVID discussion. We're expecting presentations from Dr. Park and from OES. Whoever's ready, please step up first.
Good morning. Thank you. If we could start the PowerPoint. Thank you. Okay, so I'm here today to do a COVID-19 update as usual, and starting off as usual with the epi curve, which again shows that the surge that we had through the winter is now resolving, and our case rates are coming down progressively. I want to show you that the case rate is nearing that red line that gets us to the red tier. We remain in the purple tier, and of course, the red line represents a case rate of 7, and you can see that the progression towards that line that we're making. And the numbers that are getting posted today will show that we have now an adjusted case rate of 17.1, which is important because once we hit a case rate under 25, schools that were not open to in-person service can now open TK through 6th, now that we're under that 25 mark. So again, 17.1. You'll see that our testing positivity is 6.6%, and in our health equity quartile, it's 8.7%. The median is now being changed week to week by the state as they thought that the testing numbers are going down and really affecting our ability to reach the testing median numbers, and they thought it was fair to change it week over week. We again did not meet the testing median as less people are demanding tests. So we did suffer a small adjustment. Just want to show very quickly just a reminder of what we do need to get to red. We needed that case rate of 7, as I showed you on that red line. We would need our testing positivity rate to be less than 8%, both for this county, countywide, and also for the health equity quartile. It needs to be under 8% to get to red.
Dr. Parker, I'm sorry. And we're at 17% right now?
Sorry. We have a case rate of 17. Our testing positivity rate is 6.6%. It needs to be under 8 for the county. And our health equity quartile needs to be under 8 also, and we're at 8.7% for that.
Okay, thank you.
We're getting kind of close. We do have a hospitalization graph that I just skipped, sorry. It is, I don't know if I can go back. Yes, I can. So this shows that, concomitant with our case rate falling, our hospitalization rates have continued to fall. And as of yesterday, we have 121 people in our hospitals with COVID, 42 who are in the ICU. We are still above 100% ICU capacity at 120%. Out of the 42 people in the ICU, 41 of them are on ventilators. What's changing this week in the world of vaccines is that we have changed our language on SJ Ready. Yesterday we had the top picture showing on our website that we were vaccinating people 65 and over. That got switched yesterday to show that we have moved into the other 1B sectors of agriculture, food, education, childcare, and emergency services. So officially, we're fully into phase 1B with all of the sectors as well as the 65 and over, and that matches what shows up on the state website. And I said last time that I was here that we had developed a new vaccine dashboard, so if you were to go to San Joaquin County Public Health Services website and click on data, you would then go to the data dashboard, which always shows our case rates, our death numbers, city numbers, age breakdowns, but there's also now a vaccine tab, and you can see how many vaccines public health has received. We've received about 78,000 vaccines so far, Pfizer and Moderna combined, and the total doses that have been administered in the county is 95,000. Of course, that number is oftentimes higher than the actual amount that we've received because there are other entities like Kaiser and Sutter and other hospitals receiving vaccine directly from the state and vaccinating. So the total of people who have received first doses is 69,000, and people who have received second doses is 26,000. So we're getting to maybe about a 12% rate for vaccination throughout the county. If you were to look on the left side, you would see everybody in the county that has been a provider, that has that CalVax authorization, and has been giving vaccines in their clinics and in their doctors' offices. And you could scroll down because the list goes a bit lower than that, but you could get on the website and scroll down that list. This is just a quick slide to show the disbursement of how many that we've distributed that were either Pfizer or Moderna. And vaccines on hand, currently you'll see that we have 5,460 vaccines of Pfizer on hand and 5,180 Moderna on hand as of yesterday. We were supposed to receive more Moderna last week, but due to the weather problems in the country, shipments have been delayed, and we did not receive either our first dose shipments or second dose shipments of Moderna last week, and we have not received our Pfizer and Moderna doses this week, but we're expecting to get all of this week. We did receive the Pfizer last week. That did make it through the weather, the storms and all of those other things that were happening. We were able to receive those. So last week's Pfizer doses are included in the number that we have on hand, but last week's and this week's Moderna doses have not yet been received. So the 5,000 that we have, more or less for both of them, really account for some of the doses that we need to have on hand for second dosing. And we've really tried to spend down as much as we can that we could expend. So this is a calendar of events that have occurred since the last time I was here on the 9th. And just want to quickly go through some of the things that are going on. If you look at the week, last week, the week of the 15th, you will see that on the 16th and 17th, there was some vaccinations going on in some mobile home villages in Stockton, thanks to Safeway pharmacists. And that was wonderful because people didn't have to come out of their homes. And in fact, those who were immobile got visited within their own home by the pharmacist and were injected in their homes. You will also see on the 17th that in addition to the mobile homes, some of our shelter staff were being vaccinated by our mobile team from San Joaquin County Clinics. That included Gospel and our homeless shelter here in Stockton. In addition to those shelter staff being vaccinated by that mobile team, many other homeless shelter staff opted to go to Dignity, so St. Joseph's has been vaccinating them daily. We then had Wednesday, Thursday, and Friday, a larger, bigger team from San Joaquin County Clinics also vaccinating at Progressive Community Church in our South Stockton area. And largely the people who were invited to this were people from our BridgeWorks, or vaccine search system, which was the interest form we developed. And we really tried to target those from the area, but from all over the county as well, who had that high CORA risk, so people 65 and over. Starting on the 19th, last Friday, teachers were getting vaccinated at the San Joaquin County Office of Ed. They have a very smooth operation. It's very impressive. They developed their own app and a QR code system for all of their teachers, and they're vaccinating TK through 12, and not just for public schools, but for private and charter schools as well. And you'll see that for the week of the 22nd, this week, SJCOE, the County Office of Ed, continues with daily vaccinations. Yesterday, we had about 900 folks from Food and Ag vaccinated, so that was our first event for Food and Ag. Multiple farms were invited through our agricultural commissioner and also through farm labor contractors. Some vaccines were also given to some homeless residents at the Project Room Key Motel, and this was done because we know they might be moving out soon, and we want to get them vaccinated before we lose that chance. So CMC did go in there and do those folks. Just a handful. Today, Delta College is getting their 65 and over educators vaccinated by CMC staff. UOP Pharmacy did some of their own 65 and over a couple weeks ago, and now Delta College is doing the same. And we have, again, San Joaquin County Clinics this week very busy. Today, they're at OG Packing, vaccinating some of the senior packing food distribution workers at 8 of our, that represent 8 packing plants in the county that are all going to OG for their vaccines. That same team will be at Conway Homes tomorrow, and at Diablo Homes in Tracy on Thursday, and at the Sierra Vista Homes. These are the low-income housing authority homes They will be there on Friday. When they're there on Friday at Sierra Vista Homes, they will be working with folks from STAND, which is one of our local CBOs, and so they will be vaccinating people again from South Stockton as well as who live in Sierra Vista Homes, again 65 and over. And you can see, looking at this map, that we have much going on. We've got HR support at 2 schools tomorrow. We've got childcare starting on Thursday in the city of Tracy, so Thursday and Friday, again, Safeway, doing some vaccines for our child care providers. And then going into next week, the schedule is not so packed, but things are continually getting scheduled, and as long as we continue to receive vaccine from the state, we'll continue to try to have these events go on. Of note, you'll see that tentatively on the 4th of March, we might have our San Joaquin County Clinics mobile team go into HSA to do our adult protective services and child protective service workers. That's a tentative date that's getting worked out right now. This is just a quick list to show you that there are multiple pharmacies around the county that are offering vaccine. I do realize it's sometimes hard to get one of these appointments. You go to SJ Ready and you try to find one, but if you're in an eligible category, they're available to you, and they're in multiple cities, as you can see here. The Save Mart and Safeway pharmacies are stocked with vaccines by us, by Public Health. We have MOUs with them, and the other vaccines are vaccinating with vaccines from a federal program. I wanted to quickly show this slide because there's been confusion about where the public should be registering their interest. We did develop a vaccine interest form, which is from that company that I mentioned, Bridgeworks, in conjunction with Bayesiant. Mr. Chuck Davis's data was used to make this very viable and a very robust system. And vaccine search is on SJ Ready and SJ Gov and has been so for the past several weeks. And we built this ourselves, and we believe that it's very unique because it takes into account our Healthy Places Index maps, it takes into account our core risk scoring, and we can see who's got interest, and as we move vaccine events around, we can target people who have that high core score, who live in the area of a vaccine event, and get them invited. Different from that is the My Turn, which the state developed and released after we developed our own. So there's some confusion as to the difference, and My Turn is on the state's website. This is not exactly the same. It is a system in which people can also register their interest and then find out from the state when it's their turn, when their eligibility sector is up, and where they might be able to find a vaccine clinic. This we're hearing is not optional, and we're going to have to onboard with this My Turn system, and our providers who are vaccinating, the list that I showed you on that vaccine dashboard, now all have to be on My Turn as Blue Shield becomes our third-party administrator. That is the only way they'll be able to get vaccine, and vaccine events will have to be shown in My Turn. What we're trying to do is we're trying to develop a way that vaccine events are in My Turn but can still be closed part of the time when we want to take the interest forms from our vaccine search system and funnel people to our clinics. So we are keeping the system alive for now as we gather names, and we do use those names to funnel people into clinics. But at some point, as I said, we will also have to be promoting My Turn. So a bit confusing, but hopefully not clear some of that up. This is from Bayesiant, and it is a slide showing how this has worked so far with vaccine search, which are with our network, with our vaccine interest form that we developed. So far, there have been 34,824 registrants, people who have registered on our own vaccine search tool that we developed. And of those people, 4,383 have gone on to receive vaccine. So 12.5% of registrants have been vaccinated. And largely, if you look at that circle pie diagram, you'll see that we were really trying to target people with that extreme core risk or the high core risk, and we did try to get to them, and about 70% or more were vaccinated. Out of the 4,000 that got vaccinated, the majority were in those higher risk categories. So we feel that we have saved some lives doing this because we know that those are people who are really at high risk. The map just shows where these people, the 4,383, got vaccinated, or where they live, the ones who have been vaccinated. And then if you look at the race, you will see that we really did try to target a multitude of ethnicities, and that we did do a much better job reaching our Hispanics and Asians just since starting this vaccine search. I wanted to quickly go through the vaccine allocation guidelines that have been updated, and I can't go through the entire document. I just snipped the top of this. But as you can see, we're told by the state to continue with Phase 1A healthcare workers, move into food, agriculture, emergency services, and so on and so forth. But I wanted to bring attention to this document because for anybody in the public who wants to know whether they qualify in any of these sectors, this document is searchable, and if you were to scroll down, you could actually click on the links to who is healthcare. You could click on who's emergency services. You could click on who qualifies under food and agriculture, and you get these very long lists of who might qualify. And I'll just show you as an example what you would get if you clicked on emergency services. Just draw your attention to point number 6, which now says workers responding to abuse and neglect of children, elders, and dependent adults. So CPS and APS workers used to be in Phase 1B Tier 2, and now that system has become just a Phase 1A and a Phase 1B, and they've taken away Phase 1B Tier 2. They've taken away Phase 1C and Phase 2. All of that is going to age distribution. However, whereas these folks used to be in Tier 2 and had to wait, since there is no Phase 1B Tier 2, they actually do qualify now under emergency services. So just wanting to point that out and show people why we're going into HSA possibly next week to vaccinate those folks. The last thing is that there is also a list of comorbid conditions, and healthcare providers are asked to use their clinical judgment to vaccinate people who qualify if they have one of these qualifying conditions, and they get to do that starting on March 15th. So I think I'll end it there.
Thank you, Dr. Park. I'd like to get a report from our OES team, and then we'll open up to questions, so obviously everybody will be standing by. A lot of times we'll bring in the OES to share their information because it might answer some of the questions we may have going forward prior to hearing from them. Please proceed.
Shelley Lima,
Clock is
Deputy
ticking.
Director. I have very quick information for you this morning. Move right along here. With the help from County ISD and a Spanish translator, the Office of Emergency Services has begun to duplicate SJ Ready into a Spanish version. We're really excited about this, probably going live later this week. The Joint Information Center is working with public health for ongoing messaging about vaccine hesitancy and doing other public outreach on vaccinations. Some of the items under development are online town halls, Q&A for Facebook, which will be pre-recorded, as well as other media, ads, TV, radio, posters, newspapers, etc. Dr. Park shared most of the concerns about limited vaccine supplies and the state's third-party administrator plans with Blue Shield. In the meantime, OES has been working with public health, San Joaquin County clinics, and contractors such as OptumServe and HR support to establish vaccination sites throughout the county. OES has plans in place for additional vaccinators when supplies improve. This includes both fire-based EMTs and paramedics, as well as EMS-based EMTs and paramedics. They've mostly completed their necessary requirements and stand ready to assist us. We've also many healthcare professionals that are available in our disaster healthcare volunteers depository. I know Dr. Park covered most of the vaccination events. This is lists a few of duplicates that she mentioned as well. I did want to call your attention to the one at Stribley Park, which is the VA. I know there were some comments about that one where the Palo Alto VA folks are coming out to do some vaccinations for VA people. This will be a multi-county opportunity for various counties, but they will be starting at the Stribley Park on later this week, it looks like. Also not listed here are second dose vaccines that we'll be doing at the American Legion and other sites such.
Would you send that slide to all of us supervisors so we can share this and promote it?
The slide doesn't have all of the exact dates and times yet. We're still ironing out some of those details. It depends on how much vaccine we can get. As you're looking at this, Stribley Park, for example, from OptumServe, is going to start out at 100 per day because they just simply don't have enough, but they will be moving into a ongoing vaccine track record, I guess. And the Manteca area, Linden area, and Lodi area, those sites are still being worked out, and OES is working with those cities, the city of Tracy, the city of Stockton, to help with the operational collaboration. Once these are confirmed, they will all be added to SJ Ready, and that's where we'd like everyone to go first to get the information, because it will be the most up-to-date and current information.
Thank you.
You're welcome. And lastly, I did want to share a little bit of information about our COVID testing that's been going on. Here's a list of our 14 sites that we know of throughout the county. These are also listed in SJ Ready. But I do want to call out your attention that OptumServe sites, which are at the Lodi Library and in French Camp, their capacities have dropped significantly. Lodi Library is at 41%, whereas French Camp is at 8%. All of our testing sites are reporting less than half capacity for the last few weeks. A good example of this is HR Support, who the first week of January was averaging 109 per site. Only last week was down to 37 people tested per site per day, which represents about a 66% decline. And that's the end of my report.
Excellent. Thank you very much. Bringing it back to the board, any questions for our OES director or Dr. Park? Supervisor Wynn.
Thank you, Mr. Chair. I appreciate all the improvements you've been making on these, on our website, et cetera. I appreciate the slide that shows the locations of future clinics. I think one of the things that would help us supervisors in our offices is to have that information available. We get a lot of calls, like the one that was yesterday in Lodi, which was agricultural based. I know their target was 750, and I think they did 900, at least what Dr. Park said. So it was very successful. I was out there. And I got a test also. There was only one person in line ahead of me, so you're right, there is a low. But, my question on that is, I understand it's a requirement, but, you do things to gather information to make decisions. So my question, and maybe we've covered in the past and I've just forgotten, but so we're getting these tests required at a certain level per day or per 100,000. And what do we do with that information other than report it to the state, and the state says, you meet that particular statistic? So how are we using that information and pushing these tests, and how does that help us other than just a number to our goal to provide the state, and then the state automatically says, you're okay, you're good?
So when it comes to testing and following those people by contact tracing, the most important part of it is we give them, each and every single one of them, a phone call and tell them to stay home. And that's the most important part of contact investigation and contact tracing. Then we follow all their contacts, find them, and ask them to stay home in quarantine. Yes, I know that there's a lot of demand for this to lead to numbers. Where is the virus getting picked up? Where do these people get it? Those kinds of things the state does try to track based on what our contact tracers give them. But the way I see it is the most important part of that CICT team is getting people to stay home.
I understand that, but when we talk about contact tracing, we talk about locating areas where it potentially is spread, whatever, but we never hear where those places are. And I guess my point is, it would seem like we would maybe generically, but at least inform the public that these are the locations, maybe geographically, but certainly by type of business, where you're most susceptible to acquire the virus. I don't, unless I'm missing it somewhere, I don't get that information.
Well, we put that on our dashboard as number of outbreaks and what industry the outbreaks represent. We do not put exactly what home, what restaurant, what place had COVID tracked back to it. And that's hotly debated amongst a lot of people. The state at one point was thinking about making that very public, and I think that they pulled back and didn't, and then they said they were going to just do it by sector, like percentage of gyms, percentage of people who picked it up in a hair salon, and then they didn't do that either. We have that sort of information, Supervisor Nguyen, and I'm happy to share it with you if you're curious. We don't put out in public which school had an outbreak, which school had a positive kid in a class. Just know that it's happening, and it does happen in a lot of different and varied places.
Well, I appreciate that. I'm not expecting, to list the schools and the businesses, things like that. But, when Dr. Galley comes out, our state health director comes out and publicly says that they closed down restaurants simply to keep people from socializing without any scientific evidence that restaurants are any more attractive to the virus than any place else. People lose faith in government. Decisions aren't made on science. They're based on somebody's opinion that this is the way to go. And again, I actually this morning I was watching a gym owner in San Francisco that her business is gone because, and I only bring that up because, as a country, we have obviously both sides of the spectrum, but when you look at nationwide that the 10 highest unemployment rates are in states that have restrictions, and 10 out of the 11 who have the lowest unemployment rates don't have restrictions, or at least not as strong. And I only bring that up because the question arises is, why are we in California so restrictive, and yet we've seen in the graphs just a tremendous spike in it. And I go out, I'm sure you do too, and most people, I mean, once in a while, a rare person doesn't have, but I haven't seen any recently. We're doing everything we've been asked to do, and yet it's not any better than in states that don't have the restrictions, especially on businesses. And so the question arises is, why are we killing small businesses? And it was talked about earlier in regards to our needs in regards to Christina talking about the children and the effects upon them. Again, I've said this before, we're focusing on one aspect of this and we completely ignore the rest of it, which is really devastating to the public at large. And I know you're not, I know you're just following the rules, I get it. But it's very frustrating to have that happen. In regards to Blue Shield, from the document I read, there was a clear indication of the direction the state is going to go in regards to focusing on a particular population. From what has been said in regards to our bridge works, as opposed to my turn, is our system is much more surgical, I'll put it that way, than theirs, because we can pick those individuals or neighborhoods that are most affected by the virus, or potentially, as opposed to a generic statewide system that is more broad-based. And so I'm again disappointed that we worked very hard, all of you worked very hard to come up with what I think is a state-of-the-art system. And now we're going back to we had the Cadillac, now we're down to a Chevy in regards to this system. And it's sad, especially with all the time and effort that all of you put into it. So that's my concern. And again, this whole process has been frustrating, and people have gotten to a point where they're just, it's just lockdown fatigue. People are just tired of it, and I really think that at some point in time, now they're talking about us wearing masks till 2022. And so a lot of people are either, one, scared to death that something's going to happen, or two, are so fed up with it that they're just going to do the things they want to do. Like, they can't socialize in a restaurant or a movie theater, so they'll socialize in a home or a park or whatever. I think we're really creating more of a problem than we're solving. But I appreciate, your diligence and certainly your leadership. But again, I think this state is, especially from the standpoint of overly restrictive measures to really inhibit. And I think back to the time when I first heard, when this started back in March of last year, that they were going to require seniors to stay home. I thought, no, they're not going to do that. We've gone way beyond that. We are so totalitarian in this state. It's just unbelievable that I guess the public hasn't totally revolted, and I know they do. So again, thank you for your comments, and thank you to OES for what you do. Thank you.
Supervisor Wynn, just to be clear, did you have a question or direction for staff? Since, I mean, these are all extremely valid points. I'm just want to narrow down when we're addressing staff. Do you have a suggestion or a course of action for us to consider at the board?
I think this board has taken action regarding the governor with a letter asking for Department of Public Health to answer some questions that we provided. I think that's adequate. My point to Dr. Park and to OES is that, I think they're doing a great job. I think that we can improve upon it, certainly the communication. And so, and she answered my question in regards to Bridgeworks and my turn. I think we find...
Yes, but I would love the opportunity to clarify even more on that if possible.
Sure.
So, and I'm equally frustrated with the state. I will tell you that, Supervisor Wynn, and I agree with everything you've said. We wish, as health officers, that the state had come out with their My Turn system before the vaccines started coming to us. That would have made so much sense for a system to exist before we even started getting the vaccines. And without it, many counties went forward and developed their own systems or bought systems. We feel that ours is quite robust, quite unique, and really hits the health equity quartile strongly. And so that's one point. Another point I wanted to make is that in early talks with the My Turn folks, we were told that we would be able to take those names out of our vaccine interest form and batch import them into My Turn, so that those 34,000 registrants, their names would be smoothly, just uninterruptedly put into My Turn, so that the My Turn system would know that these people already had an interest in the vaccine. And we were told just late last week on Friday that that was no longer going to be allowed by the folks at Blue Shield, that this batch importing of names couldn't happen. So the truth is, people who have done the vaccine interest form need to now go back and do a My Turn interest form. It would behoove them to try to be on both. And I will tell you that we have no choice but to try to angle our website to show that if you have an interest in vaccine, we're now routing you to My Turn, because we just have to, as Blue Shield, the TPA, starts to take more control. So just wanted to really emphasize that that is happening and we can't control it. What I meant when I said we were going to keep our vaccine search up is I meant that the names that are in there, we still have them and we still want to use them when we have the ability to direct people to vaccine events. So, for example, we have a soft launch today at Stribley Park. The state has given us OptumServe folks to run a daily clinic, and we've placed it in the city of Stockton with the help of the city of Stockton at Stribley Park. They're only doing 100 vaccines today, but they're going to increase daily. And what we found is that at these sites that have been given to certain counties who are in wave 1 of Blue Shield onboarding, is that people who are in My Turn from other counties can actually get messages to come to our county to get their vaccine. And so that was very frustrating because the vaccines are coming out of my allocation. And so we've had some talks with the folks at the state, and I wanted to clarify that what's happening right now at Stribley Park is we're asking for them to be operated as closed pods where we can still take people who did that vaccine interest form, our vaccine interest form, and funnel them to that site. I don't know how long we will be able to maintain that sort of agreement. We're just starting today, so we will see. Things might change, as early as next week as far as the amount of control we have over directing names to that site. But we're still trying to use that list.
I appreciate that. I heard from supervisors in some Northern California counties where they have residents from another county that are signing up for appointments. And like you say, there's only a limited amount. So that's frustrating for them. Supposedly, this is over a week ago on one of the calls. I don't know if it's been fixed or not, but again, we're trying to take care of San Joaquin County residents. And I appreciate your comments, and I understand the challenge you face, but I'm glad that we were able to. I'm sorry that unfortunately what we were told originally didn't pass, but on the other side of it, I hope that we can use that data to again focus, because I think that's probably one of the best ways to meet the health equity component in it, as opposed to depending upon my terms. So thank you, Mr. Chair.
Yep, and again, Supervisor Wynn, you bring up great, valid points. So thank you. We need clarification and any action we can take. That's appreciated. Supervisor Rickman.
Thank you, Chair. Just a couple of things. I know on Saturday, February 13th, I sent an email to OES asking for community provider networks, things like CVS. And CVS came out with locations for vaccination, and South County wasn't included in CVS, and which is kind of very frustrating. And I asked for points of contact to these community provider networks, so that my office could text or send them a letter or call them and to get some vaccines for South County. So I would appreciate that information sent to my office. It's been over a week since I've asked for that, and I believe it was mentioned in public comment today about, I believe, our CPS workers not being put in the system for vaccination. But Dr. Park, I just wanted to make sure, I know we responded to her and responded to you, that they do qualify under emergency services, and you will work with HSA to set up a vaccine day for their CPS and APS workers, correct?
Yes, and credit to Director Chris Woods at HSA, who has been advocating on their behalf. As I said, CPS and APS workers had been in the old system in Phase 1B, Tier 2, which is no more, but they have been slipped under emergency services now, and we are mandated to vaccinate them. So Joan Sing-Song's group, the group from San Joaquin County Clinics that has been going around and is going to be doing the housing authorities and has been doing some of our other clinic events, they will go to HSA likely next Thursday. That's all in the works. As long as we get all the vaccines that we are expecting due to weather delays, we are prepared to supply them with the vaccine for that.
It's on. Just speak into it.
Doesn't appear to be connected. If you'll wait just 1 second, Mr. Rickman, I'll have staff bring you a handheld microphone.
Oh, it's back on again.
Sure.
All right, I'm good.
Thank you.
All right, here. As for the vaccine that we have 10,500 still on hand, right? And those are being held for second doses, pretty much?
Yes, so we have to watch that number very carefully. For example, with Pfizer, there's about 5,000. We know that we've just given 10,000 to the Office of Ed, and in 3 weeks they're going to need 10,000 more, possibly more than that if they end up doing more like 11 or 12,000 people. So this week they're vaccinating continuously, and if they end up needing some more, we will turn some more over to them to let them finish. And so if it turns out to be 10, 11, 12,000, we need to have that same amount in exactly 3 weeks.
Okay.
So you could see that on average we get 2,000 to 3,000 Pfizer doses to be used as first doses and 2,000 to 3,000 to be used as second doses per week. We need to accumulate to 10,000 again and give it to them in 3 weeks' time. So there's a purpose for that.
And we don't know what, that's great. I just want to let the public know, because we are still getting calls of, hey, when can I get vaccinated? For us in South County, it seems like it's Safeway. We called and there's no appointments available. So that's something hearing constantly. So I just want to know, let people know what's going on there. And we don't know how many we're going to get this week, if that was correct. And do we have any knowledge or information that if they're going to bump up the doses so we can start having like mass vaccinations like you see here in Stockton, but in other parts of the county as well? You know, of course, I represent South County, so South County or in the north somewhere. Do we have any information that we're going to get enough so we can start doing these mass vaccinations so we can have the equity that we seek throughout the county?
Yeah, thank you very much for that question. So the plan was from public health was that we would continue to distribute second doses to people who needed them, and anything that was coming in as a first dose shipment, we would plan events through that amount. Then we got word that we should probably not do any more first dose events because Blue Shield was taking over, and we didn't know for sure if they would even do the second doses for people once they took over. So just finish out your second dose events and don't do first dose events. So it's been very confusing. Blue Shield was supposed to transition the first wave of counties in this week, and there's been a delay. So that is why I say that whatever I keep getting, if the state's going to keep giving it to me, I'm just going to keep planning. So yes, we are looking at the city of Tracy and South County for later this week, perhaps this weekend even. And so that's something that OES is working on. And it wasn't on my calendar because it's not solid yet, but we do have that school in Manteca coming up. We have child care providers coming up. We have Diablo Homes coming up, and quite possibly a mass vax event in Tracy this weekend or early next week.
All right, thank you. And, of course, Manteca, Mountain House, and Lathrop was all included in that. And I just wanted to let you folks know, too, Mr. Diedrich was out there, and you, Dr. Park, that, myself and Supervisor Nguyen, along with several supervisors throughout Central Valley on Friday the 12th, we met via Zoom, the governor's cabinet, and we requested, that the state must immediately increase vaccine allocations to the valley. And we further requested that the state immediately add food and agricultural workers to the allocation methodology formula for distribution, so hopefully we can get more and we can vaccinate our ag workers, and which it looks like we're doing. So, it was very productive. Hopefully they will listen on that. Outbreaks. So since things have been lighting up in the last, have we had any new outbreaks? I know Supervisor Nguyen mentioned it here, but like in a restaurant, small businesses or churches or anything like that?
No, nothing like that. We continue to have a spattering that we were able to trace back to clinic settings or skilled nursing facility type settings, adult residential homes. Okay.
Oh, that's fine. I know we're trying to get through this as fast as possible. And I agree 100% with what Supervisor Nguyen was stated earlier. What about data and science? I know on January 25th, around that time frame, state health officials told, and this is reported by the Associated Press, that they were keeping all the data secret because they complicated and might mislead the public, and that's for the state. And have you had any, in regards to this archaic and arbitrary closures and restrictions that we're having here in this state and here in this county, have you received any new data or science that would explain that? Because if you look, the reason I ask this is you have now 2 U.S. Supreme Court cases dealing with freedom of religion, and again, it boiled down to data and science. The state didn't prove their case. Just recently, as of Friday, this last Friday, in the case of Gardinera versus County of San Diego, and that same rationale was explained why you can have youth sports in that. So what we're seeing is, these archaic and arbitrary closures of businesses, youth sports, churches, is not being led by science or data. So that's the reason I asked you that question. So have you received any new information based on anything?
No, and as I said, no, there's been no actual science shown to us by the state. They look at multiple studies, but haven't shown us any science that they're conducting, any data that they have gathered on their own. I'm not privy to that. But of course, they point to many studies, and with the new youth sports guidance that came out, they point to the American Academy of Pediatrics guidance a lot. Going back to your old question about allocation, I just want to address that really quickly. There is a 70-30 split now, starting this week, that decides how much vaccine each county gets, 70% based on how many 65 and up you have, and 30% is based on the sectors. So teachers, childcare, emergency services, food, and ag. Based on that, we did get a slightly higher allocation assigned to us this week. Kind of confusing because I was told that I assumed that the 1,000 extra doses we got this week allocated to us was based on the fact that we have a lot of ag, but then I'm also told that I was supposed to get extra doses to cover for that vaccine clinic that's going on at Stribley Park.
Okay, I mean, I just wanted to, you made a quick point. I'm going to make a quick point and rebuttal that here. You know, on this court case, Gardiner versus County of San Diego, Dr. Gandhi, MD from Harvard, currently a professor of medicine at UCSF, and her writings, Immunology, AIDS, and COVID, she states, to a reasonable degree of medical certainty that the rate of virus transmission in high school sports is equal to or less than that observed in Major League Baseball and National Football League studies. But the kicker here is the respondents provided no pervasive evidence in opposition to Dr. Gandhi's declaration, and the court is persuaded that at this stage, more than halfway through the school year and the final school year for many, the continued prohibition on competitive sports will cause irreparable harm to the petitioners. That just goes to show my point. The state's saying one thing, but yet they have provided no evidence or data to support this. And this isn't just politicians talking. This is actually, courts agreeing with what Supervisor Nguyen and what I believe this whole board has been saying for the past several months. And with that said, I want to thank our counselor, Mr. Miles, and Dr. Parker. I believe you were inquired about this also, submitting the Public Records Act request to the state of California, asking for a plethora of data and science to have them explain why they're doing with what they're doing. I believe that's it with the question. I just want to make a quick statement that, as Supervisor Nguyen said earlier, it's just frustrating on our end. I mean, what you're seeing here in the state and here in San Joaquin County is, Orwellian, and it's arbitrary, and it's disturbing. I mean, a basic human right to work is being restricted by the state. I mean, there are constitutional issues, freedom of religion that I've been harping on for the last couple of months, the right to peacefully assemble, the due process of the Fifth Amendment, the taking clause of the Fifth Amendment, huge constitutional issues in which seem the state has suspended these rights, and it's disturbing. And, we've written the governor and our legislators on multiple times, and our voices aren't being heard at the state level. And, we can sit up here and hit our fists against this dais constantly, but unless, we act, through litigation or whatever it may be, we have a duty to protect our residents. And again, this is based on, it's arbitrary. There's no data and science that we have seen behind it, and it's wrong. And we have to continue to push forward and fight for our residents, our restaurants, small business owners, and so on. So with that, Chair, I'm going to give it back to you.
Thank you, Supervisor Rickman. Supervisor Villapudua.
Thank you, Chairman Patty. First of all, I want to thank you guys for that presentation. I know you got a lot on your plate and you're working hard. Just curious, last week, Chairman Patty and I had a meeting with Jose Rodriguez from El Concilio, and he basically asked us, what are we doing as far as literature for the Spanish speaking, and as far as making it easier for them to sign up for a vaccine test. And I was wondering, do we have the capabilities to print some literature in Spanish, and can we maybe put up, the website in Spanish? Is something like that possible?
The Joint Information Center is working very actively right now on that Spanish piece of this SJ Ready site, and also producing more literature. We make it a point to try every single thing that we have promoted is in English and Spanish. So we're making that a priority.
Great.
Make sure that that happens. And I think you're going to start to see a lot more as time moves forward, especially now that we've been able to bring in a certified translator.
Perfect. Thank you so much.
Both the interest forms too, both the My Turn and the interest form that was put up by the county is both in English and Spanish as well.
Wonderful. Thank you. Now, as far as a time frame for like migrant workers, farm labor, logistics workers, you see happening in the next 30 days or so?
So we are on a continuum where we've delved into 1B and we're just going to continue. Teachers will have a stop date, but once they get their second doses, but Farm and Ag is going to go on for a while. But we were very happy to be able to start yesterday at the Lodi Great Fairgrounds and then today out at OG Packing. So we'll continue to work with people, and there's many people contributing to this effort, and we'll continue to do events for them. And they are eligible to go to any one of those other sites that are on SJ Ready.
Okay.
When it came to the farmers, we did also do an interest survey in Spanish that was distributed by our agricultural commissioner to all Spanish-speaking farms as well.
As far as farm labor, is there an age limit? I mean, is it 50 and over, or is it anybody? If you're a farmer, can anyone go?
I'm sorry, I couldn't hear you.
If you're a farmer, can anyone go, or do you have to be 50 and over or 65 and older?
So we did start saying that we would like to do 50 and over because there's so little vaccine, and we're trying to get to the people that are most at risk. So the events that we have run so far, which was just yesterday and now today, are targeting the senior farmers, yes. We will eventually move it down into lower age groups.
Okay, thank you very much.
Dr. Park, for clarity, you had mentioned that Blue Shield, I've gotten conflicting information from the presentation. Blue Shield is now an authorized distributor of the vaccination, but you had mentioned earlier when speaking with Supervisor Wynn that it sounded like Blue Shield is going to become primary and the county would be no longer staging events. Is that correct?
So Blue Shield is not a vaccinating provider. They are the third-party administrator that the governor's office has hired to try to come into the system and make everything uniform across counties. So they are going to have the state continue to allocate vaccines to providers, but skipping us as the middleman and having everyone on board with the same systems. So My CA Vax, My Turn, everything's being named My to keep it consistent, so that everybody who's a provider has to enroll in My CA Vax. Anybody who's going to be vaccinating has to be on My Turn. People who want a vaccine have to look on My Turn. And so that's one system that the My Turn system is a system that the state has purchased from Salesforce and Accenture to develop. Blue Shield is the administrator of the entire process. However, they say that it's Yolanda Richardson at the governor's office who's really deciding how all the vaccines get distributed. So and it's quite confusing, but our understanding is that once we transition to Blue Shield, public health will no longer be receiving vaccines and then turning them around and giving them to this cardiologist office or this hospital or this person who can mobilize it. We will tell them who our best partners have been, who our most productive partners have been, and then they will pick from amongst our providers to directly distribute vaccine to. We don't decide how much each one gets. Those people who are doing vaccine events will then put the event up in My Turn. Well, they'll create an event, and then people will have to try to get an appointment through that system. So what Blue Shield is doing is they're overseeing this whole process of distribution and allocation and data entry, and everyone has to use the same data sources to put in your vaccine so they can follow who's getting vaccinated and how many people have been vaccinated. So they're trying to make everything uniform.
This sounds like a tremendous bureaucratic loss of local control and very complicated. I can't imagine the manpower or the system that is required to address each county and each department and each needs and each allocation and each identified local area of concern or partnership. How do we opt out of this and maintain some local control?
There's no choice to opt out of it. We cannot opt out of having an agreement with Blue Shield, and we've been told that there's no option to opt out of My Turn. And there are many counties that have done very well with their vaccine distribution plans. We all feel that we were really ramping up our capacity, forming a lot of partnerships, doing a great job trying to hit our health equity, and disadvantaged folks, trying to get the vaccine into communities where we know the need is because we know our own communities. However, despite us as health officers not really wanting to onboard, we have no choice, Chair Patty. And so yes, it has been quite bureaucratic and complicated.
It sounds like it. County Council, and obviously with the 58 counties in the state, could we and have you and through Dr. Park, again, in partnership, we are trying to protect our citizens. Nobody's going to do that better than us who have created an infrastructure and relationships and distribution and identified. And the Bayesian program is stellar. It's remarkable, the extra steps and actions we've taken here in this county and the activation through OES and our multiple levels of agencies and departments and the leadership that's been shown to accomplish what is in place. So I would ask that if Dr. Park and 57 other medical directors in the state and our county council and 57 other county councils, we look at this in a course of action for a continuation of autonomy for us to be able to follow through and execute versus getting caught into a big, tremendous bureaucratic system like Blue Shield, which is a universe. It's not a local proximity. So what can we do? And I would ask what we can do in the most expedient manner possible.
We'll have to do some exploration on it, Supervisor Patty. This is, I agree with you. I think everybody in the room agrees with you that this is a big power grab by the state, that it is really upending the system that public works or that public health and OES have really built up over the past few weeks. But we will look into it, and I will coordinate and see what I can find out what other counties are thinking as well.
Okay, and please, and if there's any action or measure, I mean, these are people's lives, and this is, for the benefit of our community and to save people's lives. If we need to call a special emergency meeting to address something and spring into action, and again, as Supervisor Wynn has pointed out, and all of us, we've all, brought this up repetitively, and we need to be proactive. This is very, especially when they said they would integrate with our system. We went through the effort and the actions that we've taken to be as proactive as we are and as efficient and as effective as we are. And it's just the rug's pulled out from underneath us. And we're now at the behest of a global entity, Blue Shield. No disrespect to them or what they have planned, but I do not imagine that they could handle our local concerns better than we can, as we have completely accessed all of our resources and positioned ourselves in such a beneficial manner. So compliments to all of you for being as successful as you have, but this is absolutely unacceptable that the state is making a mandatory action like this. I have a couple questions I would ask and follow up on Supervisor Villapudua. I would also ask that you reach out to Bobby Bivens at the NAACP. It seems like there's some reservation and some concern in the African American community on their trust in the vaccination. So I believe we need to do some community outreach and involvement in any way that us supervisors can be involved with that messaging that would be beneficial to our community. Equally, as noted, please contact El Concilio Jose Rodriguez and just make sure that he's getting the information that you're saying is available. Last week when we called for a meeting with him to review these types of concerns, there was a void. There was definitely something missing. So there's some sort of disconnect of what may be readily available. He just didn't have it available. He didn't have a knowledge of it. So that would be beneficial. What is the discussions that you're having? I know you've shared some information. Is there a point where the state, amongst your conversations that you're having, is there a point where the state has addressed all the 58 counties and understand that there's a greater level of supply coming forward, or are we just onesies, 1,000, 2,000, 5,000 sporadically. Do we have any knowledge of supply?
No, I don't have any specific intel from the state as to what percentage of an increase we can be expecting, what kind of windfall the state might be receiving from the federal level. Just a lot of hope as we watch the media and the national news coverage and watch the coverage on the Johnson & Johnson vaccine, which is getting reviewed by the FDA this Friday. And we're all just hoping that what we read in the news is true, but not getting any numbers or percentages from the state.
Okay, and then lastly, Dr. Park, we have an event for veterans coming up, I believe, this coming weekend. It's upcoming. There was a lot of confusion. A lot of them are senior, and I believe if we have access to communicate those that have signed up, and whether it be directing them to sign up through another platform, we should really be sending out weekly messages. And I don't know how we can tailor that to each group or individual, but there was a lot of concern and a lot of phone calls to 211. I think there was a misunderstanding that they needed to be somewhere this last weekend, and a big concern. So if we have a platform of communication and we're able to send out messages to those that have signed up, let's just keep information coming once a week, a little note, you're in the line, you're in the queue, we have a date coming up. Yes, Director
Just
Lima.
want to point out that OES has a group of people who are actively phoning every single person that received a shot on January 30th and 31st, which was our veterans event, to make sure that they are registered for this weekend. So they are physically calling them in person. So if they haven't received that call, they're encouraged to call either OES or 211 and make their appointment time, and we will take care of them. We've gone through most of the list, and things are looking really good. In the future, moving forward, what our plan is that as soon as someone gets a shot, and while they're waiting their 15 minutes, they're making their appointment for their next shot. And so that's how we're working that. That way we have those people in the room, and we can make sure they get what they need moving forward.
Okay, and I know that platform was created so we can message. So the more message, more information. Again, there's a lot of seniors, and they're very unsettled.
Yes.
Their schedule, they really are, they want to book it around doctor's appointments or family appointments, and they like to have their schedule in order. So thank you. I appreciate great work. Any other questions from any of the board members? Supervisor Rickman.
Real quick, and Dr. Park, thank you. And you can see the frustration, especially, I can speak for myself. I'm frustrated as all get out. If I had hair, it would probably fall out. But I just want to say, the reason I say that is, a lot of this is directed at you, but it's not at you. We understand you're doing as best as you can with the information that you have and the resources that you have. We all know where it's coming from. It's coming from the state, and they're pretty much directing you what to do. So please don't take it personal, and please, know that it's not at you. Okay, so thank you for the job you're doing. Counselor, what in that San Diego case on Friday is just a temporary restraining order. It's coming back, and I believe it's March 5th.
That's correct.
What does that mean for this county? Does that have any? It has no jurisdiction here.
It has no control. Has no control over this county. That is a Superior Court action,
Right.
so it's specific to San Diego.
Why? And this is the thing. It's just frustrating. We talked about the U.S. Supreme Court case even before the U.S. Supreme Court ruled on it. We talked about youth sports. We talked about a lot of these things today. What can we do as a county? This might be a legal question. It might be a closed session discussion, but it's frustrating to me to see we get up here and we rant and rave, but nothing gets done. But then you look at different counties like San Diego County, and these businesses or entities, whatever, things are getting changed. Why aren't we, if we're so passionate and about our residents and getting people back to work and all this stuff that we talked about today, why aren't we doing more? And that's my question. I mean, I don't know if it's, litigation like we discussed, amicus briefs, whatever it may be. But if it's working in other places, it's our discussions are directly on point on a lot of these things. So we should be doing something more than just sitting up here and ranting and raving about it and getting nothing done.
Well, to your point, Supervisor Rickman, the question is, in that case in San Diego, there you have two individuals who have sued both the county and the state. my understanding that San Diego didn't have any order, had never issued an order on youth sports, had not taken any action against youth sports, just kind of got lumped in, presumably so that jurisdiction would exist down in San Diego as opposed to having it bringing up in Sacramento.
I know the name in there was also the California Department of Public Health.
Correct.
More than one. I mean, where does the county fit in this county? If we see this case and we don't have, as a county, what are our options to change the behavior of the state? And I guess that's a question I'll pose to you. I mean, I guess that's a question that we can have in closed session at some time, whatever it may be. But, I mean, something has to be done. This is ridiculous.
Yes, Supervisor. We'll schedule an update at the next board meeting for a closed session discussion on litigation strategies. As were a similar lawsuit come forward in San Joaquin County, we would do the same thing. We would go into closed session and have a discussion with the board of how the board wanted us to respond to that suit. But similarly, we don't have any orders addressing youth sports. We have always followed state guidance as we're required to.
Right.
And when courts have changed the guidance, we have always gone with whatever the court's guidance was as well. For those who may not have seen it, late last Friday, I think it was, Dr. Park did sign an order that rescinded the existing orders that had been issued in the county, except for the isolation and quarantine orders, to streamline it. We had always issued those orders in the past so that people could look to one place for that information. But with trying to keep up with the changes that are coming from the state, we decided at this point it's probably better to just direct people to the state for that information as it changes by sectors.
Right. Well, thank you. I know we're at the mercy of the state and of the status quo, but the status quo needs to be moved. And, unless people in our position fight back, then nothing's going to be resolved. So, with that being said, I'll yield my time. Thank you, Chair, for your patience.
Thank you, Supervisor Rickman. As a follow-up to that, with this precedence established in San Diego, what legal action can we take to recognize this precedence and any local measures we can support negating or dismissing based on the legal issue? As I know, there's oftentimes recognition of precedence that's been established.
This case doesn't set any precedent, Supervisor Patty. It is a Superior Court case. You don't get that precedence until you get to appellate levels. And so this case, especially this is at the very onset of the case. And so it is not precedential in any manner. There is an item later on the consent agenda this morning that addresses a similar topic. And so that is obviously one way for the board to take action, is to support various enterprises and convey that information to the state.
Well, the question, and that is item number 21, which I'm pulling to speak, and I will openly read this resolution for the record, but is that with any teeth? Does that have any depth to it that would allow, I mean, baseball season's upon us, the high school sports that have been allowed, we're still in this purple tier, not allowing some of these activities. To Supervisor Rickman's point, and as Supervisor Wynn points out, I mean, we are held hostage, and we have all expressed the interest in concerns for our citizens and the children. Many of us, we have kids, grandkids, and we represent the citizens of this county. I know we have all expressed to be more proactive. I believe we need to set a course of action today, this point forward, of what we need to do, and the board is assembled. If it needs to be agendized, we need to step forward into this so that we can help our children get back to some outdoor activity. We can help them receive some of the great benefits of being a child and participate with friends and build relationships and be mentored by coaches and have a positive influence in their life. And they're held hostage as we are.
I think you said it well, Chair Patty, is they are held hostage as we are. We are required to abide by the directives of the state, the state public health officer, and cannot adopt orders or guidelines that are more lenient than what the state allows.
And what would it take for us? What mechanism needs to be in place for us to strike that recognition?
You change state statute.
Change statute?
Yes. And short of a change of state statute, it would require an order from an appellate level court and probably the state Supreme Court in order to somehow determine that the actions of the state are that the governor or the state public health officer have somehow exceeded their authority or acted in an arbitrary and capricious manner.
And what would it take for us to set that course and that challenge forward?
That is a conversation that we should have in closed session, Supervisor.
Do we have to agendize that, or can we talk about that today?
No, we cannot talk about that today. It'll be agendized for March 9th.
Okay, thank you. I look forward to that, and it's a very important conversation for our youth. Thank you. Any other questions? We'll move on.
I have a quick one.
Supervisor Miller.
In light of this conversation, I just want to ask Dr. Park, I know you're very involved in the organization of all the public health officers in the state of California. So my question is, the restrictions so far, have the public health officers taken, you're all medical professionals, have the public health officers been advancing a position to the state that the restrictions are arbitrary and capricious and not in the public's best interests? Or, what I'm trying to get at is, it's easy for us to say the state as this big monolith, but the state is getting a lot of input from your organization who has to implement these. And I know, we have this item 21, which, as near as I can tell, is advocating to basically open up all youth sports with no restrictions whatsoever. So I'm very curious as to how do our public health officials, our doctors, feel about the restrictions at this point? I know they've been loosened quite a bit, and our numbers are coming way down. So in light of the changing situation, what's the position of our medical experts?
Thank you, Supervisor Miller. So, we do have a new youth sports guidance, which just came out on February 19th, which allowed for more sports to be played in the state of California. This released by the California Department of Public Health, admittedly under great pressure from organizations like Let Them Play and others. So they released guidelines that do allow for sports to be played outdoor, moderate and high contact sports that were put into the red and orange tiers, allowing them to be played in the purple tier once you get to a case rate of 14, with some caveats, with an informed consent, and for rugby, football, and water polo, not just the informed consent, but a testing requirement. But so it means that kids can now play football, high school level football, for example, as long as your county's at a case rate of 14. As I said earlier this morning, our case rate is 17.1, so we're almost there. And when this was introduced to health officers, there were many who were upset by this, not because they thought it was arbitrary or capricious, but because they actually thought it was too permissive. So a lot of sentiment that why should we let high school football teams play with a case rate of 14 when we don't even allow them to go back to school until we get to a case rate of 7? So that case rate of 25 that allows schools to reopen is only for K through 6. For middle school and high school, you're not allowed to reopen until you get to a case rate of 7. And yet this new guidance says you can play football or any high contact outdoor sport at a case rate of 14 with those specific caveats. And so there was some pushback on that, and I think that there are some local health officers who are in opposition because they think it's actually too permissive, not the opposite.
And so being able to open for the older kids, 7 through 12, how do the public health officers feel about that metric of the case rate having to be as low as 7?
Right. I mean, they feel that you should not be able to even think about opening up sports until we actually get the kids back in school. And so they felt that the numbers should at least match each other. And it doesn't the way it's been put out.
Okay. Thank you.
Yeah. You're welcome.
Supervisor Wynn.
Just a quick question. So their complaint was the disparity between the two standards, correct?
Yeah, their complaint is that we need to focus on getting all kids back into school first, not focus on these individualized sports and whether they are allowed to play. So basically, high school CIF sports, baseball, football, they're allowed to play at a case rate of 14, but those kids are not actually in school to get to case rate of 7. So that was the complaint. Is that what do we do about kids who have 4-H clubs or who are on debate teams and who are in choir? None of them have been allowed to do any of that because it's considered a gathering, yet the focus is so much on sports. And why do we make these allowances for sports? So that was the complaint.
Well, I understand that. I guess the question is, though, is, the CDC has come out and talked about opening schools with some directives, which are very permissive, by lack of a better term. So it would seem to me that rather than ratchet down sports to the 7 of opening schools, the simple solution from my vantage point, and I know I'm not in your position, is that I would make the opening schools at 14 as opposed to 7, which gives the equality that they're looking for as far as not only being in school but also participating, as opposed to going the other way and trying to meet the 7 standard. So I understand their concern, but on the other side of it, I think there's a simple solution based upon what current CDC policy is in regards to opening schools. Thank you.
Supervisor Rickman.
And thank you. And, and that doesn't make any sense. I agree with Supervisor Wynn. How do you have 40, I think over 40 states have allowed some youth sports, and even this court case, we're talking about indoor sports as well as, the majority of other states have allowed. And the CDC has talked about opening schools, and yet at least our public schools in South County that I know of are still closed. So, and where did your position stand on, or let's get deeper into this if you want. Why are we talking about just one aspect of it when we're not talking about drug abuse, depression, suicides, and child abuse? And a lot of these, I was talking to someone that I know that works at the district attorney's office, and they were talking about, the child abuse cases are low right now, and one of the reasons they believe that is a lot of these child abuse cases are brought forward through the schools, through the system. So, you're talking about one tiny aspect of it, and nobody's looking at the rest of it. I think I've asked you before, what's, the suicide rate in the county? What about drug abuse, alcohol abuse, dropout rates, and all these different things all come into play. And that's why I think it's important that we do open up our schools. And I still don't know the reason why they're not open yet. Can somebody explain that to me? Is that because it's a school board decision? I know it's not our decision, but so the local school board would make that decision, correct?
Yes.
So if somebody has a problem with that, they need to speak to their school board officials. But there's more moving parts to this than just the one aspect that we're just looking at right now.
That's it. Thank you.
Thank you, Chair.
If that's all, I think, and thank you. I know you're engaged, and these are great discussions. I really don't like to limit, and we don't, because this is it's a hotbed issue for the citizens that we represent and the children and youth. I mean, in your conversations, there's anything that's when we're talking about outdoor sports is much different than choir that might be done indoors. So if they're looking for everything being equal, you slowly walk things open and see how it works. So it's not everything at once. You've opened up the floodgates of risk, so that we're able to, and I'm sure in your conversations and as an experienced pediatrician, you know that how important children's health is. So you may not be able to do everything, but at least you can do something, and you can step by step, stage by stage, see that it's not critical mass. It hasn't created difficulties, hardship. We have not overwhelmed, which is the reason why we do everything that we're doing. We don't want to overwhelm the medical system. So if we're moving forward one step at a time, that would be the best approach that I'm sure you're championing on behalf of our youth. I'm not putting words in your mouth, but I would imagine that to be true.
I have tried, and I've said that in the last Board of Soups meeting as well, that we did try to champion for youth sports.
Yeah, but in your conversations with other health, doctors, you're championing the same thing, and there's unison in this?
Well, I didn't have a specific conversation with other health officers on this. This was introduced to us on a state call, and we could only see what people were putting in the chat and what people were saying in public comment, but I didn't have a direct conversation with other health officers.
I would encourage, hearing all of the board and the importance that we're talking about, I would encourage outreach, communication. There's 58 of you directors in the state, and if you're able to have a collective view and voice, no matter what anybody does, there will be someone that will have objection to, and well, what about this? And it's not fair. And they'll say something slanderous, untrue. They can, go off in any direction to discriminate against an action or a person. I mean, it happens. So we can't please everybody, but if we have truth, if we have, proper motivation and justification and the value of kids engaging in sports, recognizing that they may not be able to do everything like choir inside closed quarters, but if they can do choir outside and spaced accordingly, then let's have, it's not a matter of, as I say, it's not a matter of if we do it, it's how you can do something safely. And we're all just pleading on behalf of those we represent that we're doing more. So perhaps next meeting in 2 weeks, you can let us know how this effort might go collectively if you've been able to speak with other medical health directors, okay?
Thank you.
Thank you very much. Moving on to consent items. I had mentioned I'm going to pull number 21 and read this proclamation. But do we have Supervisor Rickman? Do you want to pull anything from consent?
No, Chair.
Supervisor Wynn.
Item number 1.
Item number 1. Supervisor Miller.
No.
0. Supervisor Villapudua. No. 0. Okay, then we will start off with item number 1, and I will also pull item number 6. Supervisor Wynn.
And as Russ gets down here, I'll ask him a question as he's walking toward the microphone. Actually, I pulled this for a reason, not just the request, but the activity with our air cargo component, which is mentioned in the staff report in regards to potential for growing. So I just wanted for our director to talk about what's going on as far as expanding our air cargo category and how this is going to benefit attracting those types of carriers that would participate in our airport.
Sure. Through the chair, basically I'll give you a little quick history on what's going on with the cargo ramp expansion project. That's been on our capital improvement program now for several years, and we've been anticipating funding, and as you know, we have to have projects shovel ready before we really can be in a position to accept the grants, and that project has been shovel ready, and so we've been waiting for funding from the FAA. We were going to use our CARES money, and there were some issues with wording, and so we added the cargo ramp expansion project back onto our capital improvement program for next year. So we're hoping to get funding in FY22 for the cargo expansion. Basically, how this is going to benefit the airport is this one project. By the time it gets funded, it'll probably be $11 million, $12 million. Not sure what the economy is going to be doing, but that is going to be the hinge for the entire expansion. And this is Russ Stark talking, for the growth of the airport and the region. If we can get that cargo ramp expansion project completed, that will facilitate another 4 cargo aircraft. So a total of 8 cargo aircraft will be able to handle at any given time at the airport. As you know, Amazon is building a 56,000 square foot facility. This will enable us to take more airplanes, whether it's from Amazon or from another cargo provider. And it will also enable us to expand the taxiway system on that side of the airport and continue to build. And it also works very well with the Air Park 599 project. So we have a lot of things going on at the airport. And what does this mean for the county? Well, it means, one, jobs to handle that additional cargo, and it means more aircraft and growth at the airport. So in the end, that cargo ramp expansion project is our signature project at the airport at this time.
So will the addition to 4 more pads, so to speak, would that double our current revenues based upon our 4 existing?
Yes and no. Previously, we had 767 aircraft coming in, but 737s now are becoming kind of the thing in the cargo market. So right now we have a fleet mix of 767s and 737s. 737 basically handles about 1/2 the cargo and 1/2 the fuel. So we could make projections. So I would say it would probably increase our revenue 1.5 times.
Okay, very good. Okay, thank you. Appreciate that.
Yes, sir.
Any other questions from the board? Okay, thank you, sir.
Yes, sir.
All right, we will now move to agenda item number 6. I have a question for Ms. Brandy Hopkins, HR, please. This is the amend the exempt job classification for Director, Employment and Economic Development, HS 1250, authorize the chair to sign the amended class specification and increase the salary range for the amended class effective April 5th, 2021. Question for you, Ms. Hopkins. In your research, you've got, I see that you've got a slight increase of the salary that is currently utilized for that position. Is that correct?
That is correct.
Where did you come up with that increase in comparison to, I know that I had asked you, and I believe eventually you were able to speak with some staff in that department, and they had given some recommendations in order to bring in a top tier candidate that would really maybe perhaps take this department and bring it to the next level up. They had made recommendations to make that salary competitive to what would be, neighboring counties and what they're paying. So how did you derive a low measure of increase versus what was suggested or requested that we might be able to do to attract that top tier candidate?
So the Human Resources team reviewed our standard 10 county comparables, which includes our neighboring counties. Mm-hmm. And what we came to was that the current salary and total compensation was between 11.8% and 9.4% below market median. The 4% brings us into a 5% range that has historically been the board's philosophy. That is where the recommendation came from.
So we're going to be recruiting somebody knowingly at a lower level.
Our recommendation is within the standards that the board has historically put out, which is that we stay within 5% of the market median.
Stay within 5%. So we could be 5% above or 5% below. Is that correct?
Historically, my understanding is we've tried to stay within below 5%, right around the market median or right below 5% of the market median.
Okay, but historically, it doesn't seem to be relevant in some of the decisions we've made. We've established that if it's perhaps a difficult to recruit position, or if a position comes on board, it should enter at a higher level. Why would we bring somebody in at lower than 5%? We've established that we're not looking to do that anymore.
So an answer, that's a good question, Chair Patty. I think an answer to your question is that we are still remaining within the board's parameters that have been outlined for human resources in the past. We have not conducted a recruitment at this position for a very, very long time here in San Joaquin County. And when I've talked to some of the other county HR directors, it's not historically typically been a hard to recruit position depending on the organization. So I don't have data in San Joaquin County to rely upon at this point in time. As we all know, Mr. Solis has been a wonderful director for this county, I think for close to 40 years.
Correct. Okay, well, I'm just curious. I know that speaking with people with experience in that department and their recommendation and their knowledge of even a viable candidate that would be outstanding, that I believe you finally were able to have some communication about that type or that quality of candidate, but our salary offering would be below what that person and others like that type of person would be interested in coming to the county for. So I guess we'll go through with this recruitment process. And who is it that will decide or choose the hiring? Do we go through a screening process and the board chooses that person, or is that something done through HR or the CAO?
This is a board appointment. That is one of the changes that we have here in the recommended job specification.
Okay. And what's the timeline that you're going to be putting out at the recruitment and go through this process?
If approved, or once the board approves the recommended changes, we'll be ready to open the recruitment within a few days.
And when will that recruitment be closed? It may be listed. I'm just asking because you're here.
Well, we were waiting to make sure that the board approved this morning, and then we will work next week to open it. The standard recruitment process, usually for a department head, will probably be a 3-week opening.
A few weeks? Okay. Well, my concern is that we're bringing in people below market and below value. If we're going to be looking to attract somebody that comes in with experience, we certainly wouldn't want somebody coming in without experience coming in at the executive level. But if we're going to be attracting somebody and they're for a lateral move and we are below market by at least 5%, this is concerning. If we're looking to hire the best people going forward, why would we look for somebody below the best at a discount rate? It's a little bit concerning. So this might be a bigger agenda item to discuss with the board of why would we want to be 5% below the comparison counties? And that's a factor that we need to perhaps take a deeper dive in and an analysis. But, we've established precedent already. So, I'm thinking that, maybe this needs to be agendized and discussed. If you're saying that you're following past practice, which we've seen recently, that doesn't really matter very much. So how would you recommend that we best address that protocol, that we're not hiring somebody below the market, so we're not getting somebody less than what would be the top tier?
Sure, Patty, if that's something that the board would like Human Resources to research and bring back some recommendations to the board, we would be happy to do so.
Okay. Well, that's my opinion on this. This is open for discussion. If any other board members would like to weigh in on it. Supervisor Wynn.
So as I understand it, HR followed the formula, the pattern or precedent that this board has established probably before I came on the board. Is that correct?
That is correct, Supervisor Wynn.
Okay, so for the most part, you're just doing your job as far as this recommendation, correct?
We're trying to make a sound recommendation to the board. That is correct.
Okay. I understand where Supervisor or Chair Patty's coming from, but my experience has also shown that when you recruit a variety of candidates with a variety of qualifications and experience and degrees and a whole bunch of other things. So it would seem like, at least on the first go-around, we would go with your recommendation, because dependent upon who we get to apply, there may be a candidate who wouldn't be at the top level that John Solis is as far as his experience and training and those types of things. So it's like everything else in regards to hiring somebody. Oftentimes with lesser qualifications, you may offer them a less amount as opposed to a higher amount based upon somebody who comes with 25 years of experience in this job and all kinds of recommendations and qualifications. So it would seem like the first go around we would go with what you're offering. 5% obviously is not a big amount, but I understand where Supervisor Petty is coming from. But if that were not to work, which in the past it hasn't, we've usually come back, or HR's come back and asked us to increase the amount to provide a better recruitment pool. And so is that basically what you envision as far as going through this process?
When the Human Resources team and I discussed the recommendation of 4% to keep us within the 5% market median, it is our hope that we will still find candidates that meet the criteria and meet the board and the county and the community's needs with that particular recommendation.
Okay. All right. Thank you.
Supervisor Miller.
Thank you. So when you say it gets us within 5%, that's 5% of the median of the salary survey?
Correct, which is a standard class and compensation review.
Correct. So what I'm getting at is that doesn't mean that every single county we will be 5% below. That means we will be within 5% of the median. So some of the surrounding counties may actually be paying less than this, and some may be paying more than 5% more than this, but this gets us within 5% of the median.
That is correct, Supervisor Miller.
Okay, and so it will really depend on what the market is like in this region and who's looking for this type of opportunity. Very often we get folks who have been at a county who've been behind somebody like John Solis, who's been here for 40 years and haven't had an opportunity to move up into a director position, and for one reason or another may not want to relocate out of this part of California. This may be a very, very attractive recruitment. So I would support going through this, and then if we find that it is a hard to recruit position, then we will do what we've always done, which is perhaps adjust our offered salary. So thank you.
Thank you, Supervisor Miller. All right, then let's go forward with the recruitment, and we'll see what that yields. Thank you.
Thank you.
I'm now going to address consent item number 21, adopt a resolution in support of the Let Them Play movement. I'd like to read this resolution into record. A resolution of the San Joaquin County Board of Supervisors for the purpose of supporting the Let Them Play movement. Whereas we must make San Joaquin County children's mental and physical health a priority, and whereas youth sporting activities give direction and a team identity that provides discipline, accountability, hope, and character-building experiences. And whereas more than 3 million children have been benched from playing sports since March 2020. And whereas the current guidance from the California Department of Public Health will keep most youth sporting activities and competitions shut down in 2021. Whereas the current memorandum on California youth sports creates an alarming social equity disparity as private schools and exclusive club teams continue to participate in sporting activities. Whereas the ban on youth sports is having a devastating impact on California inner city coaches report a sharp rise in gang membership, drug and alcohol use, school dropouts, and incarceration. Whereas this ban on youth sports competition is currently creating an alarming negative mental health impact in the areas of suicide, ideation, anxiety, depression, and suicide itself. Whereas more than 40 states have proven that it is possible to allow youth sporting activities to continue with limited COVID transition. Whereas families are leaving California and moving to other states in order to continue participating in sporting activities. Whereas California coaches are capable of following local, county, and state guidance and creating environments where students and coaches work together with extremely low COVID transmission with no reported hospitalizations or deaths. Now, therefore, be it resolved that the San Joaquin County Board of Supervisors affirms its support for the Let Them Play movement and the California State Assembly, and urges the California Department of Public Health to issue new guidance that will permit youth sporting activities and competition in California to resume immediately with proper safety protocols in place. Be it further resolved that the San Joaquin County Board of Supervisors reaffirms its commitment to the health and safety of all its residents. I wanted to read this into record. Do any supervisors have any follow-up conversation based on this prior discussion, but this resolution now being read into record and on our consent?
I actually have a...
Supervisor Miller.
Thank you. I was going to pull this myself, and it was really about the process. And I spoke to County Council about this, but it's always been my understanding that things go on the consent calendar when they have been thoroughly vetted through our various departments, our staff, that they've been researched, and that they are considered not requiring further conversation or presentation. My concern is that this item came to us on a consent calendar without that process. And I think this should have been brought forward as a discussion item under COVID. I think there should have perhaps been a presentation as part of our COVID discussion. And in light of the other discussion that was going on, that could have been filtered through. That didn't happen. And so I've asked County Council if we have any sort of written policy on this. It doesn't appear that we really do. So I would like to request that County Council come back to us for with some recommendations on this, whether it just needs to be board rules or, it's only been a few years now that any supervisor can agendize an item. And so I think this is just something that's stemming from that. And I think we need some guidance in the future on our process. So I would like to request that this be, not this item be brought back to us, but that we have County Council bring some recommendations back to us on this process. And so I would request that this is pulled for a separate vote because of the lack of process on it.
Through the chair, Chairman Petty, I'd be happy to address Supervisor Miller's comments.
Yes, Madam Clerk.
Thank you. Supervisor Rickman's office had recommended this item come before the board. And in looking at past practice of the board for adopting resolutions, I reviewed it and it appeared that they came under consent calendar. So it was sent to the CAO's office and County Council and placed on the consent calendar based on the information that I had provided.
Thank you, Madam Clerk. Appreciate that clarity. Supervisor Rickman, would you like to add anything?
When we're talking about consent discussion items, if we pull an item, and apparently we did today, what's the difference of discussion? We are discussing it. I'm just, we're not trying to push this through. We pulled it, we're discussing it. We did discuss it in, pretty good length at COVID. And it's something that it could have been brought up in COVID. And that's one of the reasons I brought it up in COVID. But if it's in consent, all you have to do is pull it, correct? And then and you're discussing it.
That's correct, Supervisor. From my perspective, the only distinction truly on when you're pulling a consent item is if it's coming from one of the departments, having given the department advance notice of your intent to pull it so that they're really prepared for a full presentation instead of having it on consent and assuming it's going to go forward, on that basis.
Okay. Chair, I don't know how much discussion you want me to get into the item itself, or?
I'm a little bit uncertain what the concern is here. County Council, is there a legal ramification of us showing support for this movement? What seems to be the jeopardy?
Not aware of any jeopardy that attaches to approval of this resolution.
So then talking about the support, whereas more than 40 states have proven that's possible to allow youth sporting activities and continue with limited COVID transmissions, talking about the benefits of sports and participation, the increase of gang membership, drugs, alcohol use, school dropouts, and incarceration, where you're looking at all the myriad of negatives that are happening with sports being shut down, and us just having a simple resolution without it putting us in legal jeopardy. I'm curious where the pushback on this would be, and where this stands out as a no-go. We shouldn't be doing this. Is there? Supervisor Miller, perhaps you can share where your concerns might be on this.
Well, first of all, my concern was more about, as County Council said, that this didn't come up with any input from our public health officer or from the Public Health Officers Association in our state. I appreciate other states have done this. None of the numbers are basically verified. It just came to us in the form of a resolution. I would have just liked more process in advance. All I'm requesting is a separate vote on it. From my standpoint, I don't believe there's been enough input from the California Public Health Officers Association on this group, in terms of whether or not they recommend this. And I am a firm believer that we should be following the recommendation of our California public health doctors and medical establishment. So that's all I'm requesting.
Sure. Madam Clerk, where did you get the language for this resolution?
This resolution was not prepared by the clerk's office. Board items are prepared by the board offices and submitted directly to the CAO's office and County Council, and then we bring it forward on the agenda.
Thank you. And so, Supervisor Rickman, can you please share with us where this language has been qualified?
We took it from the assembly. It says in there, let me grab this here. It's modeled after Assembly Gallagher's resolution.
Okay. Well, I see no problem pulling it for a separate vote, and I'll gladly go on record. I'm proud to have read this resolution, and if and when it passes, as I believe it would, I'm very proud that this county is taking a stand on behalf of children, youth, sports, and activities for them to get out and let them play.
And
so,
Chair, I just want to, if you don't mind,
please.
And I read this earlier. And this is from the limited temporary restraining order that was issued in the Gardenero versus County of San Diego. And this is available to anyone who wants to, try to find it. I couldn't find it. Somebody provided it for me today. But this is part of the reasoning of the court. The court, in regards to, talking to the state and getting the state's permission. And it just seems that this is one of the problems we have with, closing our small businesses and our churches, and because, the states, and we talked to even Dr. Parker agreed about, the data and science, that it's not there. And that's one of the reasons we're doing the PRA. But this is here in case number, or the docket. The court then turns to the issue of irreparable harm. While adults may minimize the importance of youth sports, our youth do not. Dr. Gandhi states that the continued isolation and detachment pose a serious risk to our children and is something that must be accounted for. The respondents, state pretty much, the respondents provided no persuasive evidence in opposition to Dr. Gandhi's declaration, and the court is persuaded that at this stage, more than halfway through the school year and the final school year for many, the continued prohibition on competitive sports will cause irreparable harm to the petitioners. Okay. I think that says it all.
I appreciate that. Thanks for sharing. Seeing no further discussion, I'm going to call for a vote on our consent items. Supervisor Wynn, yes.
I certainly appreciate the effort by Supervisor Rickman to bring this up. I think, and I don't want to speak for Supervisor Miller, but I think the question was in regards to process as to how we would do these in the future. And I think, correct me if I'm wrong, Supervisor Miller, but that we would go to county council who would come back and share with us what the proper procedure would be for these types of items, which would include at least vetting with a particular department or county council.
Well, that would be my hope, and that was my request, that county council come back to us with a more formal, either a board rule or a more formal policy for the board on agendizing items. This isn't the only issue we've had with agendizing items by board members. We've had some items come before us even for discussion with absolutely no information whatsoever attached to the item. I just think it's time that we have a look at this and the process is more clearly defined. I mean, as near as I can tell, this came from Supervisor Rickman's office, the language came from his office, and county council's office reviewed it basically from strictly a legal standpoint in terms of if there was any risk to the county legally. My position is we didn't get any input from our public health officers or from anybody else here locally on this item itself. So I would just like to see our process come back to us a little more clearly defined.
Madam Clerk, clarify one more time. Did we follow process and protocol, or did we circumvent anything in this instance?
Through the clerk's office, as far as putting this item on the agenda, there was no processes circumvented. I think to Supervisor Miller's comments, as she's looking at before coming to the clerk's office to place an item on the agenda, that maybe some more policies be adopted or guidelines be provided to board members in how they go about vetting their items, pulling together their board letters, and what information could be provided. If there's a consensus of the board to want to do that. Once you get past that point, to put an item on the agenda was followed. I think to her comments, if the board wants to consider it through this process of possibly requiring all board office items be discussion items and not consent, we can certainly follow that as well.
Okay, so Supervisor Miller, would you like for your office to generate a request to agendize this for a discussion, if possible action by the board?
I'm requesting and hoping that the board will provide direction to county council. I would like to see what county council's recommendations are in conjunction with the clerk of the board for a process for us to follow when our offices, when we opt to agendize something ourselves, an item. That's all it is. I don't think it requires a motion to do that. I'm simply asking county council and the clerk of the board, perhaps with input from the CAO, to come up with a more well-defined process for supervisors.
County Council, would you please advise if this is something that needs to be agendized for discussion, or this can spawn naturally out of a consent item discussion?
We can take that direction from the board. I'll work with the clerk of the board and the county administrator. We'll bring back a report on what the established process is for items coming forward, being placed on the agenda, and then some options for determination of whether it's a discussion item or a consent item.
Excellent.
In that case, there's no need to pull this item for a separate vote.
There is no need to pull it.
Not as far as I'm concerned.
Okay, very well. Then we look like we're finished with this discussion on consent. Supervisor Rickman, are you?
I'm just thinking here, and if we're bringing the what Supervisor Miller wants back, and there needs to be something in there too. I mean, the time frame. I mean, if we're going to run through more procedures, and I mean, death by procedures, death by committees. It's just, I mean, if the board wants something back here, it shouldn't take longer because we have to go through additional procedures. I mean, for example, if there's something that's time sensitive, there needs to be a carve out in there for something that is time sensitive. Maybe a court date coming up, or a ruling, or governor's announcement, or whatever it may be. there needs to be something in there if we're going to bring this back, so we can discuss that also.
I would also ask CAO Lopez, with your experience, what based on the nature of this conversation, would you like to share any insight or information?
Mr. Chairman, thank you. I don't know what changes have been made over the last several years, but historically, when an item is placed on the agenda by the board, unless we see something that obviously should be considered by other departments, we'll put it on the agenda as consent. As the board fully knows that if there is an issue that catches someone's attention, any board member can pull it off of the consent calendar and discuss it. In this case, perhaps we failed to see the connection with the health department, because I think that's a valid point, that if others are opposed to this, why would we support it? When I read it, I thought it was kind of something that was popular right now because of all the concern regarding what's open and what's not open and what the impact is of having something open and not open. It's been very, very difficult. I mean, as we listen to public health officer make her presentations every time we meet, there is a lot of confusion in this, and so perhaps it was just an oversight on our part, but I don't know that there needs to be a written procedure established. Consent items are generally those that on the face of it appear to would not generate any controversy. This one obviously does have some, but I believe it's been discussed at this point, so it's really a matter of whether or not the board wants to accept it. We will come back with some thoughts on what should be consented, what should be on for discussion. But I just off the top of my head, I can't think of anything other than, is this something that's either wrong or is it going to generate controversy?
Mm-hmm. I know when my office generates something, we run it to county council, we run it through the clerk of the board into the CAO's office, and we get feedback, we amend it, we moderate, and then bring it forward after it's been vetted and approved. So there may or may not be any changes necessary. Not everybody may agree with everything that's on the consent item put on, but we pass that idea that. And obviously, no one supervisor is stronger or more influential than any other. So I remember Supervisor Wynn, you're the one that had brought this forward so that there was a parity on the board. So I'm not sure if we want to start scrutinizing and targeting. But Supervisor Wynn, something to share.
Real quick, when we changed the rules to allow supervisors to agendize items, the intent was to give them more flexibility or freedom in regards to bringing issues up, as opposed to having to go through the more cumbersome process. But on the other side of it, it was not intended to, for example, have a supervisor go to a department and ask them to do a staff study on something unless the entire board had given that direction. So in deference to Supervisor Rittman, I appreciate his effort. There's some things that I think would have liked to have seen, for example, the changes in the state's guidelines on youth sports. I don't know if that's addressed through this or not. But on the other hand, I certainly agree with his effort, but I do think that there needs to be some guidelines through county council and possibly in discussion with each one of the supervisors as to, how far do we go in regards to engaging staff? Because my experience both on city council and the board of supervisors is that staff doesn't operate at our direction as an individual supervisor. Staff operates in regards to the majority vote on the board. And so to prevent that, I think we need some guidelines to at least give us an idea of how much information we need to include. And probably, as CEO Manuel talks about, maybe these should be discussion items as opposed to consent, so we can have a full-throated, full-board discussion based upon what the supervisor has provided for us not only review before the meeting, but certainly discuss in regards to how we would want to proceed by a vote of the entire board. So I would agree with allowing county council to give us some guidance, and certainly that would make it more consistent in regards to how each one of us handles these particular individual agendized items. So thank you, Mr. Chair.
All right, thank you very much. I believe we're done at this point. I'm going to look for a motion to approve our consent item, agenda numbers 1 through 22.
So moved.
Second.
I have a first and a second. Please vote. Consent passes 5-0. We are now moving on to our morning public hearing. We have item number 3, since we had done 1 and 2 prior, to conduct a public hearing on the designation of Mr. Chris Bellaggi as the County Road Commissioner effective March 1st, 2021. Anyone wishing to submit written comments for this public hearing may do so by sending an email of 250 words or less to sjpubliccomments@sjgov.org. I'd like to call on our department's staff for a report.
Thank you, Chair Patty, members of the board, CAO Lopez, County Council Miles. Good afternoon. This is the public hearing is being conducted to designate Chris Bellaggi, Director of Public Works, as the County Road Commissioner. California Streets and Highway Codes Section 2006 specifically requires the road commissioner be a registered civil engineer. Mr. Bellaggi has held that status since January of 1993. Mr. Bellaggi previously held the status as the Director of Public Works for San Joaquin County. The announcement of today's public hearing was published with the record and also posted in the county courthouse, providing at least a 14-day notice in accordance with legal requirements. If approved, the effective date of the designation will be March 1st, 2021. At this time, the board may receive any comments on this designation. Thank you.
Very well. Any questions from staff? Seeing none. Madam Clerk, do we have any comments, public comments on this?
Through the chair, Supervisor, it would be appropriate to open the public hearing.
Okay, public hearing is now open.
Thank you, Chairman. There are no public comments received for this item.
Public hearing now closed. Any comments, closing comments from the board? All right, seeing none, then I believe we are ready for a vote. Motion and approve.
I'll move to approve.
A second.
I have a motion and a second. Congratulations, Mr. Bellaggi. You are now the road commissioner on a 5-0 vote, and I've got some potholes to discuss with you. All right, we're moving along pretty good here. I think we have, I think we can finish, let's finish up our agenda and take a break in between closed sessions. So let's go forward with our discussion. We have and introduce, this is under discussion under general government, introduce and waive reading of an ordinance amendment to the San Joaquin County Code of Ordinance, Title 4, Division 10, Chapter 1, Commercial Cannabis Activity to clarify the commercial cannabis development agreement requirements. This said ordinance to be adopted on April 6, 2021. Mr. Mark Miles, County Council, please take over.
Thank you, Chairman. This item is being introduced as over the past couple of years, the county has moved through the permitting process for cannabis-related businesses. Because of the absence of a tax, the county has used development agreements in order to, as a requirement for those businesses. As the businesses were coming forward and as a couple projects on business parks were coming forward, we noted that there was a disconnect between the requirement for the tenants in those business parks who are not required to have development agreements for them to have an obligation to the underlying business parks development agreement. So these modifications are being brought forward to clarify that mechanism and bind those tenants conducting commercial cannabis activities on properties with an approved use permit or special purpose plan to the terms of the commercial cannabis development agreement for that property or developer. This clarifies that the clarifies that only the developer of the commercial cannabis business park is required to enter into the development agreement, and then also, as I said, that the tenant then is obligated to the terms of that agreement as well. There are similar changes, modifications that are being implemented in development title, county title 9. That goes to the planning commission first, and that's why this is scheduled to come back on the 21st. The objective is to be able to bring both the amendments to Title 4 and to Title 9 at the same meeting on the 21st. I'm sorry, on April 6th. That concludes my report.
Thank you. Any questions from the board? Supervisor Wynn.
Mr. Miles, as I understand your presentation, this simply tightens up the regulations in regards to tenants?
That's correct.
Okay, so it's more restrictive, essentially.
Yes, it obligates those tenants to the terms of the development agreement that the developer or the property owner would have entered into, yes.
Okay, thank you. Well, having one community that is almost 100% opposed to a proposed improvement plan in their area, but understanding the need to include the tenants in regards to the restrictions, I can support this, although, as you all know, except maybe for Supervisor Rickman, this is something that I am adamantly opposed to because it's all about money and it's not about anything for the quality of life. So I'll make that statement and turn it back to the chair.
Okay, seeing no other questions or comments from the board, do we have a public hearing on this issue? It's not. So, Madam Clerk, do we have any comments from the public?
To the chair, no, we do not.
Okay, thank you. So then we're going to look for a motion and a second and a vote, a roll call vote to approve.
I'll make a motion to accept. Approve.
I'll second.
I have a motion and a second. Roll call, please.
I apologize, Chairman Patty. I believe that was an error on my part on your outline. You can go ahead and vote electronically.
Electronically? Then we will. Thank you. I followed my script.
Appreciate it. Thank you, and I apologize.
All right, that has been adopted 5-0. Thank you very much. We are moving on now to general services. We have a presentation on the Mickey Grove Zoo as a 5-year strategic plan. Yeah, we're going to announce that this item is listed on the agenda and have our department come down and give us a presentation.
Good afternoon, Chair Patty, board members. Before you, I will be presenting the 5-year strategic plan for Mickey Grove Zoo. I am Judy Vassbinder, the Parks Administrator. Judy. And is that ready to go? Cool.
Before Judy begins, I'd like to make a few comments and give special recognition to Judy, the zookeepers, the park commissioners, and our zoo manager, Jackman, who devoted a significant amount of time in working to put this together. And we're very pleased to be here this afternoon to present the 5-year strategic plan. Go ahead, Judy.
Okay. We'll begin with why a 5-year strategic plan. Back in June of 2019, the grand jury issued a report for the Mickey Grove Zoo, honoring the past, securing the future. And as part of one of their recommendations, they wanted the county to develop a 20-year master plan. And in response to that recommendation, the county agreed to create a 5-year strategic plan instead of the master plan. And starting with the 5-year strategic plan allows the department to implement these strategies set forth as a foundation for the future. As we move forward, you will recognize that this isn't answers for the next 5 years. This is just a plan to get us to keep going. A little bit of history for the Mickey Grove Zoo. It's a 5-acre zoo with some amphibians, mammals, and birds. The zoo that exists today is completely different that existed in 1957. There's no longer, a large polar bear in a small cage. We've recognized those. Today, the collection of Mickey Grove Zoo emphasizes the uniqueness and quality over the size and quantity and the concentration and the welfare of the animals. And as you can see at the bottom, just very interesting for me is the evolution of zoos. back in the early Roman days, as we go through that, they loved their menageries and curiosities. The first zoo was actually opened in France in the 1700s. And in the 21st century, it's mostly about education and conservation. One thing that we did recognize is that the zoo did not have a mission, nor did it have a vision. So that was one of the very first things we created. The mission is Mickey Grove Zoo is committed to providing an engaging experience that will foster an appreciation and respect for wildlife that will inspire a commitment to conservation through education and stewardship. And that vision would be to be a resource to the region to help inspire change through devotion, respect, and determination. And as we move forward, we recognized 7 priority objectives for the next 5 years. And as we move forward, we needed to develop a plan to update and improve the needs of the zoo, including what kind of zoo is both desirable and affordable. And that's something that we've definitely discussed before you, this board, before. These 7 priority objectives are believed to represent those needs. The first one is infrastructure, exhibits, the guest experience, a nonprofit partner, revenue, accreditation, and volunteer programming. As we get through the priority objectives, the infrastructure, our main objective is going to develop tools to plan, design, implement, and maintain Mickey Grove Zoo in the most efficient and cost-effective manner. And in progress right now, as you go through, we have completed, or we're in the progress of doing the electrical study at Mickey Grove Zoo, and we're also in progress of the viability of the East End, what is left of the East End from back in the day of what we can use and what we can salvage. As we go into the exhibits, we want to design exhibits to promote keeper and animal safety, animal health and well-being, and cleaning efficiency. The guest experience will create a positive experience for all guests utilizing exhibit standards, dining and shopping options, all while providing opportunities for all patrons to view and learn about zoo animals. The nonprofit partner, we would create goals and objectives that will yield a successful partnership with a highly effective nonprofit partner to support the Mickey Grove Zoo, a partner who will assist in the zoo fiscally and who will work together to increase awareness and foster a positive relationship within the community. The revenue would create a sustainable revenue enhancing plan that decreases the general fund subsidy to the zoo. And accreditation. We would identify and pursue an appropriate accrediting body for Mickey Grove Zoo. And I know accreditation has been brought up a couple of times, and one of the reasons why it is now on a priority objective is one of the accrediting bodies that we did find was redoing their standards, and those standards were not available until about 2 weeks ago. So as we move forward, that is another reason why the accreditation has been delayed a little bit and we have moved it into the strategic plan. And a volunteer program. We would develop, implement, and introduce an updated volunteer program that emphasizes the zoo's mission, and the program will include appropriate training and education opportunities to enhance staff representation and customer service. And as you can see, here are some top 8 items that would be year 1 of the strategic plan. And like I had mentioned before, commissioned the new electrical engineering plan. That one is already in process. And identifying exhibit standards, that was just released from an accreditation body that we would be looking at. That was just released in the last couple of weeks. And a couple of other items, that we have already in process would be implement short-term means to buy refreshments by visiting the zoo. We did have, like when we did reopening for the zoo, brought in street vendors and brought in a hot dog cart and those types of items. So these are items that we have not waited to start on. So with that, within the strategic plan promises to improve the overall operations of Mickey Grove Zoo that matches the objectives and strategies and tasks outlined. The zoo staff is comprised of a group of seasoned, dedicated professionals whose commitment and knowledge is remarkable. As San Joaquin County commits to improve Mickey Grove Zoo by commissioning infrastructure repairs, improving and standardizing animal exhibit spaces, offering guests additional amenities, collaborating with a highly effective nonprofit partner, enhancing its revenue stream, applying for appropriate accreditation, creating a strong competitive volunteer program. All of these will help inspire change through the devotion, respect, and determination of our wildlife. And once again, our acknowledgments, and thank you, Marcia, for that. We would also like to have you guys recognize that the information, the recommendations that we have provided into the strategic plan have utilized sources from the benchmarking and assessment report that was completed, known as the TOSIG report in 2018, also the grand jury report. There was also the Mickey Grove Zoo survey that was completed in 2018, and additional information through analysis, the SWOT analysis, brainstorming sessions, strategizing sessions. I have also contacted some other municipal zoos throughout the state and asked for their best practices also. And I would also like to thank Marcia for her dedication and her continued support as we move forward with this strategic plan. And for me, that basically concludes the actual presentation, and the parks asked the board to accept the Mickey Grove Zoo 5-year strategic plan, to accept and approve the year 1 strategies and tasks, and accept and approve the recommendation that annually the Board of Supervisors will receive an update on the strategic plan and current year's tasks and objectives. And if anybody has any questions.
Thank you, Ms. Vassbinder. Any questions from the board? Supervisor Wynn.
Well, I want to thank you for your in-depth analysis. We've talked about this over the years. I remember when I came on the board, the master plan was about $25 million at that time, and obviously unattainable. So a couple things real quick. I also, when I look at all the different strategies and priorities, you touch upon a little bit in regards to a study on water and sewer and things like that.
Correct.
But, in reality, that really covers the entire park, not just the zoo, because it all is interconnected. So outside of this particular plan, is there an adjacent or a comparable plan in regards to the overall park itself and how we will provide the potable water and the sewer and those types of things that would obviously benefit the zoo and obviously the museum and other parts?
Mm-hmm. At this point in time, their focus had been on the Mickey Grove strategic plan. A parks strategic plan, we will begin, I don't want to give you any promise or any dates or anything like that, but that is another, as we do have 9 regional parks, to be broken down into chunks in which the priority will be set forth. And we do recognize that Mickey Grove Park, because of the zoo, it would be in one of the higher priorities to bring back kind of the same type of same type of a program or a plan in the near future.
Well, I know that we've talked about the potential retail benefit of the park and generating additional funds for the system, not just the park itself. But the other, I guess, aspect is that I think that, and you did talk about it specifically in regards to the type of zoo that we're going to have, whether it's an indigenous type, exotic, and that's okay, as long as we have that discussion in the future, because I believe that especially in watching at our various agricultural events with our youth, our third graders, for example, that children who've especially been raised in the inner city, they don't care. An animal is an animal. And whether it be a cow or a sheepdog or whatever. So my point is, I hope we have that discussion in the future before you move forward, and more importantly, before we go to accreditation, because I know there's a variety of accreditations, and some have said, well, why do we need accreditation? Well, my understanding is that helps you in getting funding and grants and those types of things if you're certified in a particular category.
Correct, and and one of the reasons why it was delayed a little bit is because one of the accrediting bodies we were looking for, their standards. So when it comes to looking at if it's going to be indigenous, it's going to be wildlife, it's whatever type of animals we provide, there are certain standards that exhibits must meet. There are certain standards that zookeepers must have for experience and things like that. So although we have had those discussions many of times, and we have some ideas formulated in our head, we really wanted to make sure that those standards for an accrediting body were presented to us before we made that 100% decision. As you will see in the strategic plan, that decision will be made within this first year. So that will be something that we will discuss in the near future. And like I said, we were just waiting on those standards to be updated, so we knew exactly if it was plausible, reasonable, affordable for us.
Well, I want to thank you for your efforts. This is a big step forward, and hopefully in conjunction with the rest of the park and the other facets that can be expanded, I think this would be a great attraction, a destination point for the county. So thank you both.
Absolutely. And I think it's important to share, we do have 2 new members. We have moved more away from the exotic animals, and we have a skunk and a possum right now that's been added. Again, taking this holistic view and looking at all these pieces is how we can formulate and come back and specifically address. Is it a sanctuary accreditation? Is it AZA? Is it ZA? Or do we really have to? Are there other opportunities that we can leverage revenue, having a strong partner, or maybe doing a tax measure? These are the things that over the next 5 years we want to solicit and solid. And yes, the infrastructure is important and the parks are important. Judy and I know that our next step is to look at the parks, and not just the parks, but our county service areas. You know, what are we going to do with those? You know, I'm going to put a little bit of a plug in for parks right now. It's always been the underdog whenever it comes to funding, and some of this is going to require funding. But how we get there and how we accomplish that, some of that will be looked at there. You know, our grants at the state level, especially from a parks perspective, and we have some ideas there. So I want to say this isn't the end. I think it's the beginning, and we've gotten to this point through a lot of work and cleaning up that took place to get here. And it's just the beginning, and good things are to come not only for the zoo, but our parks as well.
Thank you. Supervisor Rickman.
Thank you, Chair. And first of all, if you need another possum, I have one eating my oranges in my backyard. So by all means, come get it. Quick question, though. In strategy number 3, you have continue to grow corporate sponsorship opportunities and utilize grant opportunities. Why isn't that on a higher priority?
And, you know, we've actually, the order in which we have these was of great discussion. It was a very good discussion item of internally. At this point in time, the feeling is if I don't have, or I don't say I, excuse me, if Parks does not have, or the zoo doesn't have the infrastructure and the exhibits needed for that point in time, I have nothing to offer a sponsor. A lot of sponsors, yes, they will, like, I will give you a match. Until that portion, if I want to rename the zoo as a corporate sponsorship, or I want to rename a portion of that exhibit or a exhibit with corporate sponsorship, it needs to be, I need to have those standards in place, and I need to have the infrastructure to back up what I say I can do.
A lot of these grants too want to see plans and diagrams for exhibits or for moving forward from a park perspective as well before they'll give you any type of grant funding. So it kind of goes hand in hand.
Right, I understand the grant side of it. It's a sponsorship opportunity. I was just thinking, the more money that we can get in the beginning, you know, the better that we can expand our zoo, for example, and stuff like that.
And I don't necessarily disagree with that, and I recognize that there's a large circular reference in every one of our objectives. What I am saying is, though, we still need to have a plan.
Right.
But, you know, and those plans, like I said before, we don't necessarily have every single answer in the next 5 years answered, but we do understand the questions that are going to come available and a way to get there. So corporate sponsorship, sometimes it's, you know, they don't want to sponsor something old and ugly, but if we know that there is a plan to get it to something that their money, they're going to be able to recognize where their money is being spent, and the county also is going to make that commitment to them that we're going to complete it, or we have standards, and that's the other thing that has been missing a lot in the zoo, are very specific standards, and we're talking visual standards, and including with our exhibit standards. So once we get to those and we have that written down and we can offer them what that's going to look like, then we can go for those sponsorships.
No, well, thank you. Hey, I'm a big fan of Mickey Grove. I mean, I know when I was a kid, I had birthday parties there. I remember catching, bullfrogs and crawdads there. My daughters, I don't know if you're supposed to do it or not, but I did it anyways. But, my daughters had their birthday parties, several of them over there. So, I would love to see it be as successful as it can. So thank you very much for the presentation.
Mm-hmm.
Supervisor Miller.
Thank you. I just want to thank you for all the hard work that went into this. We've been pushing for this, and I'm really pleased to see all of the input you received from a lot of different stakeholders. You were very transparent in terms of reaching out to people and hearing what they had to say, and so I appreciate it. I think this is a good, solid 5-year plan. And I especially appreciate hearing, as Supervisor Wynn brought up, what kind of zoo are we going to be, and that's going to be on the front burner for this first year. I think that's also going to have a lot to do with developing those corporate sponsorships and grant opportunities and things like that. So thank you. This was great to see.
Thank you.
Supervisor Villapudua.
Thank you, Chairman. Guys, I just want to say great job. That park, Mickey Grove, is absolutely beautiful, and you guys are doing the best you can to keep it going. And I think a lot of the families with children are going to be happy that this 5-year plan is in place. So great job.
Thank you.
I have a couple questions before we close up. What type of grant funding is available, since we are looking at, you're trying to get the accreditation and put together the plan? This strategic plan is a big step forward.
At this time, state of California is regional grants only. We are in the process, which includes Mickey Grove Park, because the Mickey Grove Zoo is part of Mickey Grove Park. So those are available for this funding this year. We all are in the process of working with the California Conservation Corps on one project that is also receiving some help with the regional park projects that has been, that we probably will begin in April as part of our partnership with California Conservation Corps. But state of California this year is regional parks only.
Understood. What type of funding, when it comes to grants, are potential? 200,000, 20,000?
Yeah, it's competitive. It's competitive from 20,000 up to 2 million.
Okay.
The state this year did not release a very large funding amount. I believe it's only maybe $100 million for the entire state. So it's a competitive grant this year.
Mm-hmm. One question I have then is, I know Ms. Cunningham, did Measure Z in Sacramento pass? It was a funding mechanism for the zoo and that park.
I believe it did, yes.
Do
Fresno also has a measure.
And could you find out how much money they've generated for that zoo? And I'm just wondering, as we're all looking to move forward with the strategic plan, if our parks need funding and our zoo needs funding, maybe a Measure Z locally for this community. And I know there's interest to expand a park in Tracy. So maybe a Measure Z that encompasses a funding mechanism that includes strategic planning and use of funds can be brought to the voters for a special park district that, if I understand correctly, at least 15 or 20 of them are in Sacramento for funding mechanisms, and they have their own board and use of funds. And we have none in San Joaquin County. We have zero. So it seems to be a mechanism that's utilized for funding that may be outside of the limitations or restrictions. As you're all looking at possibilities, we are 100% grateful and looking forward to seeing the fruition of the efforts. But we may also want to consider what that may look like if we bring something to the voters. And do you want a park? Again, Tracy is looking for a nice park expansion, and where's the funding come from? So I'd be curious about that. Maybe send my information to me, and maybe we agendize another discussion on it. And as your strategic plan develops, I'd be curious to see what comparable, like let's say you're laying out a plan that fits into the criteria of certain, regional relevance. So we know we don't have polar bears in San Joaquin County, so we wouldn't want a polar bear. But that may exclude a lot of possibilities that might be a draw to the zoo. And I'm not saying we want a polar bear, but maybe we have a mountain lion, because there are mountain lions in the region. Within 60, 80 miles of here, there are mountain lions. And I know that at one point when I was a young boy, eons ago, they had seals there, and we have seals in our delta. We could catch them and bring them to a park, because they'd be much more suited there than honking all night and barking all night and keeping residents awake in my district. So I'm just wondering what the possibilities are, and I think we'd all be very interested to hear what that vision looks like, and to enhance the experience and a great funding mechanism, allowing you all to do, maybe some expanded plans, and not just being held hostage to the grant process.
Correct.
Ms. Fassbinder, you're itching to say something.
I am, because you had mentioned a couple of things, and one of the first things I do have to say that was put in place about a year ago is a procedure. We did put a procedure in place when it comes to incoming of new animals, and part of that procedure is age of the animal, what's the vet things, also what is the draw, and that is one of the justifications when it comes to the approval of when, as the parks administrator, I say, yes, we need to bring this animal in. That is part of it. What is the draw? Is it something local? Is it something educational? That's kind of how we got the skunk. That's kind of how we got the opossum, was in regards to a little bit more educational. And then you're talking about like the seals and the sea lions and, all that kind of stuff. Supervisor Nguyen already mentioned, we have problems with water out there. I'm not bringing anything water related until that part gets cured.
Understood.
So we have taken those types of approaches for the future of Mickey Grove Zoo. And I love the fact that you guys are talking about it. That means that we're the expansion that I see in my head as a vision, you guys are also recognizing that need for it. So I really appreciate your guys' comments in regards to seeing my vision and seeing your vision, and how we can come together to make sure that the zoo is it's the best that the Mickey Grove Zoo can offer for our region.
Thank you, and I appreciate that. And I'm not speaking for any other board member. I'm just asking, throwing out all the possibilities to support what a vision. I do know I've experienced at the Asparagus Festival, they'll have a trained seal, and you pay $20 and you get a picture with the seal. This generates income for an animal that has handlers, and a mammal that has handlers and is skilled and can bounce balls and retrieve things. And people love to see the show, the interaction over towards Napa, whatever that is, by Fairfield, I guess, wherever the marine world is. There's an elephant there. You can ride the elephant. You can touch the elephant. You can see and experience. I'm not saying that's what we're going to do.
Yeah.
But just what you really don't have much interaction with a skunk or possum, perhaps. But there just may be something that we can enhance, and if it's identifying and earmarking dollars for creating that water pool again, and what that experience could bring to the zoo, and you have your mascot seal or sea lion that is that's the one that you're parading, and the community names it, and just it's an enhanced experiences. Just an idea to float out for consideration and all possibilities. Thank you.
Absolutely.
Any further statements from the board?
Chair, I like your idea about the funding, though. I mean, I know like South County, we don't even have a county park. So if there's a way to get revenue, I'll back you up on that.
Well, Ms. Cunningham, is that something that we should agendize or go through county council, or how could we talk about a Measure Z for this county to support all of your efforts and this idea going forward?
So this 5-year strategic plan will help us get there. I think we need to look at our parks and also do a 5-year strategic plan so that we're working in alliance with it, right? Because you need the same thing when you're going to ask for a measure. You have to be able to answer the questions. Well, with the park that we're trying to grow, that's a little easier, but I think we need to take a look and have those bigger discussions. I think we would go into the city of Tracy and ask the community, share ideas with them. We do have that trust that there's about $75,000, but that's just a little drop in the bucket.
75,000? Well, the
but
sky's the limit.
$75,000. So I think we need to follow the processes to get there, and that is one of the considerations. That was one of the things that TASIG ultimately recommended too. What we're doing here, and if we do the same thing for the parks, that will allow us to get there because we can answer the question that the public is going to have as to, well, why do you need this measure?
Understood. And I think maybe by our next board meeting, we can have a complete evaluation, including all the parks?
Oh, yeah, go for it.
Fantastic. Well, if that's in the horizon, I think to Supervisor Rickman's point, I know that you're all quite busy on many aspects, but it would be great. Let's take a big overall view, and we as a board may want to support an idea that, like a Measure Z, if that's identified as an option and a course of action that would be of benefit for the residents. All right, well then, I thank you for that presentation, and I don't believe we have any action to accept or receive this, correct?
That's correct as far as I know.
Okay, thank you. So then we're going to move on then, and we're going to wrap up our morning session with Board of Supervisor comments and committee reports. Supervisor Rickman.
Just real quick, I know I mentioned last board meeting about bringing something back to the board for consideration, CAO, the courts, Tracy Court, how we go about reopening that, and looking at the Sheriff Department hiring and retention. So how would I go about that? Bringing that to the board. Because we're going to need a report. We're going to need staff time on this.
Mr. Chairman, Supervisor Rickman, the board can direct us to prepare that if that's the board's desire, and we'll prepare it. We did have a short discussion, and we're doing a little bit of background. We don't have enough to present to you right now, but if it's a desire of the board that we look into that, we will certainly look into that as quickly as we can. There is a lot of history, as I can imagine that you would know that, but it's something that we can at least give you some options to deal with in the future. If you give us direction, we'll schedule it, and we'll notify the board by email or excuse me, by memo what our time frame is to bring something like that to you for consideration.
So how do I do that? Do I do it up here today, or what's the process on that?
Generally speaking, if the board, again, you don't have to adopt the resolution, but if the chairman and the board members are telling us to go ahead and do it, we will go ahead and do it. And as I said, we'll send you a memo indicating what our timeline is to bring that to you.
So, Chair, can we bring that stuff back?
Sure. C.A. Lopez, thank you. I appreciate that. And I know that Ms. Hopkins had indicated that she was maybe preparing, or we were due to get an update from from our sheriff on the recruitment and retention. We had supported him doing an incentive program months ago, and some part of last year. So I think that I'm favorable to getting an update from Ms. Hopkins, and then as it relates to a regional court that we used to have, I believe, in the Tracy area. Is that correct, Supervisor?
Yes, the building's still there.
Okay.
It hasn't been operated in probably a decade.
Right. So maybe the CEO's office can prepare something I think we'd be in favor of listening and discussing these items when appropriate.
We'll bring you a recommendation.
Okay.
Via an email to you. Or
Fantastic.
A memo to you.
Okay. Any other reports, Supervisor Rickman?
No, just that I'm on the mega region for COG. Got appointed to that just recently, but besides that.
Okay. Thank you. Supervisor Miller.
Thank you. I wanted to report to the board from the last S.J. Sarah Retirement Board meeting. We went over our 2020 performance metrics, and I thought the board would be really interested in this. Our returns are up. We had a net return last year of 8.3. In 2019, we had a 13.3. Net return 2017, 11.8. The 5-year return on the entire retirement fund has been 7.4, and I know this board is aware that the expected rate of return is 7. So for 5 years on that 5-year return, we have hit We have met and exceeded the expected rate of return. And then we also had a presentation from Chiron, an actuarial presentation, which we've had presentations from them here before for us. If SJ Sarah hits that 7% every year, now that's a big if, because we all know the market really goes up and down. But if we do, we will reach 80% funded in 2027, 90% funded in 2031, and 100% funded by 2034. 80% is considered extremely healthy for a pension fund. So we are tracking well on that. The changes that the Retirement Board has made are intended to do. In addition to that, Chiron stated that the additional county contributions that this board has been making, they have made a significant difference in our unfunded liability, and they have had a positive impact on the retirement fund as a whole. So not just our position, but the entire fund has really benefited from those additional contributions. So this year, they're not recommending any change in the anticipated rate of return. It's going to stay at 7. So all of that was very good news. Next, I wanted to report that the first San Joaquin County Women's Committee, as we discussed at our last board meeting, will convene for the first time on March 4th. I want to thank Supervisor Villapudua, our District Attorney Tori Verber Salazar, Public Defender Miriam Lyle, Child Support Services Director Lori Cruz for agreeing to participate in the process. That's so far. First order of business will be to analyze our statistics as an employer and make sure that we're providing a level playing field in the recruitment, hiring, development, and promotion of our women employees. And I also want to personally thank our HR Director, Brandy Hopkins, and her team in HR for organizing this effort and moving it forward so quickly. Supervisor Villapudua and I are both very grateful for that. And then last, I wanted to report to the board that new information has been presented to the Hospital Ad Hoc Committee about the LOI with Common Spirit Dignity since this board acted on it on February 9th. Our board rules require the approval of a majority of the Board of Supervisors if we wish to reconsider a matter that's already been decided by a unanimous vote. So I'm asking the board now to provide direction to agendize this, to reconsider the LOI with Common Spirit Dignity at the March 9th board meeting, to discuss this new information and to provide clear direction to the team. And so I'm making this request now in the form of a motion, and I would hope that the board would agree to bring this back so that we can clarify and everyone here has the ability to receive that new information.
So, Supervisor Miller, you say you make this in the form of a motion. Do we need a second and vote on it to put it on the agenda, or what's our best protocol? Because I'm aware of Supervisor Miller's concern and support this, so if she's making a motion, I'd second it.
Turn to County
Council. Do we need to vote?
Yes, you do need to vote because the rules of procedure require 3 affirmative votes to place it on the agenda.
Excellent. So when we have a motion and a second, do we do a roll call vote or electronic vote?
You'll be doing an electronic vote here shortly.
Okay. So if there's any questions, what Supervisor Miller's request is, or please vote. That has been adopted 5-0. Is that able to be put or added to our next agenda?
Yes, that will be added to the next agenda.
Okay. Thank you very much. Appreciate that. And that is all, Supervisor?
Thank you. That's all I have. Thank you very much.
Supervisor Villapudua, what have you got for us today? Did you say you're buying lunch today? We're going to get a lunch break. Supervisor Wynn.
Well, it's already been covered by Supervisor Rickman in regards to the call to the governor's office, and then Supervisor Miller's touched upon the hospital executive board. So I have no report. Thank you.
Okay, thank you very much. I have a few things to go over briefly. County Council, it has come to my attention. I know that we've got through Peter Ragsdale, and our HSA director, that we have a contract coming up for our veterans housing. Some language that needs to be ironed out, and I believe that's going to be time sensitive. So I wanted to kind of mention that, and I'm not sure if we need to agendize and make certain it's on the agenda so we're not getting too close to that point where it's a drop dead date on the language and the agreement that needs to be in place. But I believe we may need to bring something to the board to review that language. Is that scheduled or planned?
I don't know whether it is scheduled or planned. I am aware of that, and Mr. Lopez and I will be meeting later today to discuss it.
Okay, then I would ask that as soon as we can add this, and perhaps our CIO, Mr. Lopez, do you have anything to add on this?
Mr. Chairman, it is clearly our intent to bring that to your board on March 9th.
Fantastic.
I believe that's a Tuesday, but that's the date that we have already scheduled. We do have issues to iron out, significant issues to iron out, but that's that date will bring you something for sure.
All right, and that discussion would include Mr. Ragsdale to represent HSA?
Yes. Yes.
Okay, fantastic. Thank you. I appreciate the clarity on that. We have all received, I believe, an email from a constituent, a citizen in San Joaquin County, that there's drones and it just takes one bad actor, but there's drones flying over and hovering in backyards at a very low altitude, invading people's privacy, as we can all imagine, whether you're lounging, mowing your lawn, enjoying an outdoor experience in your backyard. I would ask County Council, is there precedents established, or what could we do that when you're in residential areas, people's privacy in their backyard is not invaded by a flying drone? Can we put in any type of county restriction?
We'll have to do some research on that, Supervisor.
Okay. Thank you. Please look forward to coming back on that. And I think that is all my items I have. I will note for the record that I was personally singled out and targeted, but there have been others on this board that have been targeted with baseless lies and slander about us being racist or sexist or any other ixist that you want to try to slander and attack people. These are obviously politically motivated. They are baseless. They are without any validity or truth, and I find it kind of below what the board should be experiencing, as none of those accusations have any level of truth, or do they even warrant any type of attack like that. So I'm sorry that this board has had to experience some of that. If as chairman I'm to be singled out in some of these public comments, so be it, but they are truly baseless and without any warrant, any justification at all. So I want to say that for the record. At this time, we are going to adjourn and take a break until 1:45. That's a 35-minute break, and then we're going to close session. County Council, have your report before closed session.
Yes, I do. Thank you, Mr. Chairman. The board will meet in closed session on items 2 and 3 for the closed session agenda, which includes labor update and information, as well as discussion of the matter of San Joaquin County Zoological Society versus the county.
Excellent. We are adjourned.
you.